Okay, good morning members, and I declare the meeting now open to the public online. I would like to welcome members who are participating by video conferencing this morning to enable us to maintain the social distancing requirements here in the Senate chamber. And can I also remind all members about the protocols regarding the use of electronic devices. The committee has received no apologies for today. Are members aware of any apologies? No. Okay, thank you. So moving on then to Chairperson's business. Members, we have a double meeting today in order to start consideration of the evidence that we received from our inquiry. We have 21 written submissions as well as input from families via our informal Zoom and over 690 responses to our survey. And I'd like to just thank everyone who contributed to those engagements and very significant and high quality engagements, I think, and I want to especially welcome families who took time to brief the committee in session on that as well. So the other meeting that I did this week, along with the Deputy Chair Pam Cameron, was with the Children's Law Centre, who did raise issues of concern around a number of elements of their scope of their work, including some around the regulations or potential regulations, mental health, and this has been a feature across a number of different engagements in the past while. Mental health is certainly a huge concern, and some other concerns. So they undertook that they would provide a written briefing to the committee on the issues that they were raising, so that will come to us in due course. So thank you for that. Draft minutes then, members. I refer you to the draft minutes of the meetings held on the 5th of November, which are tab 3.1 of your meeting pack. Are members content with the minutes? Yep, members content, thank you. There are two matters arising there from those. First, the committee's motion was agreed by email, and thank you everyone, and that has been scheduled now for debate on Monday the 23rd of November. And secondly, in relation to the request from the Lung Health APG, I'm afraid we don't have capacity to undertake research for the all-party group at this time, given everything that's going on within health and within the committee at the minute. But the clerk has indicated that she would be content to discuss options informally with Deputy Chair Pam as the chair of that group. Appreciate that. Members content with that? Okay, thank you. So COVID-19 disease response then. We are today receiving a briefing from the Carers Coalition, and I refer members to papers from carers organisations at tab 5 of your meeting pack. Also included at 5.3 to 5.6 are responses from a number of departments to the committee's letter regarding financial support for public sector workers unable to work due to caring responsibilities. Can I advise members that the representatives from the Coalition of Carers organisations are here today to brief the committee on issues facing those with caring responsibilities during the pandemic. So I'd now like to welcome via video link Ms Claire Ann McGee, who is Head of Carers NI, Ms Orla Watt, who is Director of Parent Action, Ms Valerie Sullivan, Chief Executive of CAUSE, and Mr Craig Harrison, Policy and Public Affairs Manager, Marie Curie. And I'm delighted to have you joining us this morning, everyone, and thank you for taking time to brief the committee. I would just like to remind you all that when you're not speaking, please place your phone on mute, and because it can interfere with the other speakers. So keep your phone on mute, please. And I would like now to go ahead and invite Claire Ann. Claire Ann, we would be delighted now to hear from you in relation to issues arising. Thank you.
Thank you very much, Chair, and thank you all for having us here today. A recent study shows that there are now an estimated 320,000 carers in Northern Ireland. That's 320,000 who, since the beginning of this pandemic, have been providing practical, emotional and healthcare support to family members and friends. This figure doesn't include the upwards of 30,000 young carers estimated to be in Northern Ireland. It's just the tip of the iceberg. There are countless people out there who don't see themselves as carers, just as a family member or friend doing their bit to help out someone in need. Everyone's caring journey is unique, and everyone will have experiences of caring during this pandemic which are slightly different. But whether you care for a partner with mental health issues, an elderly relative with dementia, a child with a learning disability, or the countless other types of carer roles out there, there are some key issues that have surfaced throughout the course of this pandemic, which will have both short and long-term effects for carers and the person they care for. As lockdown began in the middle of March, the health and social care services and special schools, relied on by so many families, stopped overnight with little to no communication on when or even if they would start up again. Families were left without vital health therapies and practical support, or where that was available, it was greatly reduced. Carers shielded with those they cared for who were considered vulnerable. They worried about care workers coming into their homes with no PPE. They feared for the person they cared for getting COVID and ending up hospitalised or worse. Many carers struggled to adapt to working from home and caring full time, let alone adding homeschooling into the mix for those who had children too. Many young carers and young adult carers tried to balance online learning, the worry over the uncertainty of whether or not exams were going ahead, alongside additional caring responsibilities. Many who attended local support groups or activities had to try to come to terms with new technologies to enable them to continue to keep in touch with the outside world. Sometimes that wasn't even an option for those living in rural communities or those who didn't have access to digital technology. And many feared for loved ones who were in hospital and care homes, unable to see them or provide the additional support that makes a real difference to the quality of care and life in those homes. Short breaks, surgeries and treatments were halted, and many carers felt abandoned as services for the person they cared for were redirected, leaving them holding the vast burden of care. In the weeks and months that followed, carers continued to struggle on as services and supports have been slow to restart. One carer commented to us recently, "I haven't had an uninterrupted night's sleep in months, and I'm exhausted, as I continually have to be alert to unpredictable and dangerous behaviour, which has become more frequent and severe by the lack of psychiatric and psychological care for several months, as the Health Trust simply stopped providing care and services." Just last month, a report from Carers NI, Carers UK, showed that 85% of carers in Northern Ireland were providing more care now than they were pre-COVID. The main reason for this increase in caring was because of services, such as day centres and short breaks, were closed or were greatly reduced. Carers also cited that the increase in caring was due to the needs of the person they care for becoming more complex as a result of the COVID pandemic and the restrictions, and because family and friends they relied on before for support were no longer available or able to help. Almost 2/3 of carers said they hadn't had a break from caring since before the pandemic, despite many providing round-the-clock care and more intense care than ever before. 73% of carers said they feel exhausted and worn out, with almost half saying they feel they're at breaking point. It's unsurprising then that 2/3 of carers in Northern Ireland feel their mental health has worsened as a result of this pandemic. Provided in people's homes behind closed doors, the role of unpaid carers is largely unrecognised, yet they provide high levels of care and support for the most vulnerable in our society. This pandemic has seen a rise in the number of new carers and young carers coming forward in Northern Ireland. Yet 7 to 8 months on from the beginning of this pandemic, they continue to feel they've been abandoned, that their voices and lived experience hasn't been heard in delivery of services or in the reset and recovery process. Carers must be part of the planning for the restoration of support services to those they care for. For many in Northern Ireland, the first lockdown restrictions lifted back in July, and some form of normality began to return for a few months at least. But this wasn't the case for many carers, as many continued and still continue to shield with the person they care for. Carers feel cut off and isolated, with over 2/3 being unable to keep in contact with neighbours, family members or the local community, and around half feeling lonely and cut off from people. The mental health implications of this long term are extremely concerning. Without access to appropriate emotional support, carers will be at greater risk of experiencing chronic stress, anxiety and depression. Many carers and family experiences are not consistent with the messages that services remain accessible. Despite being reassured that carers assessments would continue to be carried out, albeit virtually or over the phone, Department of Health data on carers assessments between April and June 2020 showed that only 2,789 carers assessments were offered in what was the height of the first wave of the pandemic. This represents a 32% decrease in the number of assessments offered in the previous quarter, and a decrease of 33% when compared to the same quarter last year. Of the assessments that were offered, 54% were accepted or carried out. This shows that where assessments were offered, more carers took up the assessment than we would normally have seen. However, the problem wasn't that not enough assessments were being offered. The problem wasn't that they weren't being taken up. The problem was that not enough assessments were offered in the first place. The quarterly carers statistics report highlights the impact of COVID-19 on carers assessments and states that carers assessments were continued to be offered and completed when requested, and that COVID restrictions reduced the footfall in clients' homes, and therefore the request for carers assessments was reduced. Under the Carers and Direct Payments Act of 2002, it is not the carer's responsibility to request an assessment, but rather the Health and Social Care Trust's statutory duty to inform carers of their right to have that assessment. The quarterly report also states direct contact was maintained by telephone at an increased level. However, the administration of information gathering work, such as that for carers assessments, was not prioritised in operational services during the pandemic. Many carers we've spoken to across all of our organisations say they've had no or very little contact with their social worker or key worker over this period. And despite many attempts to contact them, they've had difficulty reaching them or have been triaged by student social workers with no particular authority to support them. The closure of day centres, special schools and short break provisions, and the limitations in many domiciliary care packages has had a detrimental effect on the person in need of those services, but also on the carer and the family who are picking up the pieces. Loss of attendance at school and day centres is already having an impact for children and adults with learning difficulties and or learning disabilities who find change difficult and whose developmental progress has been delayed as a result of the closures and reductions, and ultimately whose mental health has been affected by lockdown as a result. My colleague Orla from Parent Action will be happy to take questions on this later. Similarly, the delivery of mental health services has changed considerably during the crisis. Lockdown and social distancing measures have halted many face-to-face services and inpatient care. However, mental health services at a community level, while also critically impacted, appear to have been able to adapt more quickly, and Valerie will be able to speak to some of this later. Over a third of carers said their own NHS treatment had been delayed as a result of COVID, whilst over half said treatment for the person they care for has been delayed, both of which has affected the individual's health and well-being. Whilst we acknowledge the difficulty in reopening services and restarting treatments due to the risk of infection for both staff and attendees, etc., the long-term impact keeping these services closed or at the current level of reduced capacity could be much greater. Concerns have also been raised by some carers about the lack of awareness and flexibility around the use of direct payments as a means to buy in supports and services. Despite Department of Health guidance on the flexibility of direct payments, carers are telling us that the approaches by different health and social care trusts, different programmes of care, and indeed between different social workers is causing huge inconsistencies, some being more flexible than others. This caused huge concern for many carers at the beginning of the first lockdown, whose PAs were shielding or self-isolating, and carers had no one else to support them. Some carers sought to use the direct payments budgets to employ family members to help them, and more often than not, these requests were refused by the trusts, leaving carers to struggle on for weeks and months on their own. The majority of carers who responded to the Carers NI Carers UK survey were balancing work and caring responsibilities. Some were retired or looking after dependents full-time, and 4% said their ability to work is limited because of insufficient social care support. Of those who were working, 37% were key workers, working to keep society functioning through our key services, and 47% were working from home. 9% had to reduce their working hours because of caring responsibilities during COVID, whilst 4% had to give up work altogether because of caring. For those who are juggling work and care, we need to see more support from employers to help them continue to provide care and work, but we also need a reliable social care system to enable them to do that. Young carers are often an invisible group who provide pivotal support relating to health and social care within their household. Through COVID-19, young carers found that their caring role increased because of being at home all day, and in a sense, there was no escape from this caring role and responsibility. They often lost their whole routine, and by not attending school nor being able to attend face-to-face meetings and activities with support networks like Action for Children, this dealt a big blow to their emotional well-being. And that there are ongoing anxieties in terms of returning to school if they're caring for family members with vulnerabilities. Often the support they receive from schools is variable, as there is a major gap in terms of understanding their situation among staff at school or within the wider community. The COVID-19 pandemic has torn up the rulebook when it comes to loss, grief and bereavement, and carers are one of the groups bearing the brunt of that. Many carers have been shouldering an extra end-of-life care burden at home and dealing with their own feelings of loss and grief without access to their support networks. Carers have been heavily impacted by the disruption that COVID has caused to community and family rituals that normally follow death. They haven't been able to rely on the wider family network rallying around them, and events that would usually facilitate collective support and remembrance, like funerals and wakes, had to change fundamentally. What this means is that during the moment when they are perhaps at their most vulnerable, carers have been deprived of family and community support that they would have had and what we would have had taken for granted a year ago. In the worst cases, they may be facing the grieving process entirely alone, and this loneliness can make grief much more intense and harder to process. Responding to this situation involves many different components, but one key aspect is ensuring bereaved carers have access to timely and high-quality bereavement support. The picture here is complicated because demand for those services was outstripping supply even before COVID-19 came to our shores. We need investment and training to boost capacity in this sector, and Craig will be happy to talk about more about this during the Q&A. So what needs to happen next? The majority of adults in Northern Ireland will care for a family member or friend at some point in their lives, but the impact on their health, finances and well-being is often underestimated. Even a few hours of care a week can have a significant impact on carers' lives if there are thousands of people caring around the clock. During this pandemic, many have cared without access to any form of a break. And whilst we understand many health and social care staff were isolating or were redeployed to frontline services, and that day centres and short break provisions can only be opened safely and at a minimum risk to staff and those attending, carers are hugely frustrated that their services and supports have not been protected at a time when they needed them most. Government must prioritise carers in its plans, carry out an urgent review of break services, and ensure that wider social care services have enough funding to manage over the winter. Whilst much has been done to rightly recognise the work of health and social care professionals in this pandemic, the role of unpaid carers have played in the effort against COVID is forgotten. Many carers feel invisible and unrecognised for all that they do. With the recent increases in local lockdowns, carers will be continuing to provide high levels of care through the winter months. It is only fair that they are recognised for the invaluable role they play in the national effort at this time, but also that they receive the right support. It's easy to see why carers feel they've been abandoned and left to cope with everything alone. They're worried about their ability to continue to provide care over the winter and through the rest of this pandemic without more supports in place for them and the person they care for. In the short term, we need to see the quick and safe reopening of day centres and short breaks. Ultimately, if treatments and services for people with disabilities, mental health issues, etc. are reintroduced, then some of the burden on carers will be lifted. Carers need to be involved in the planning and reopening of services as part of the wider reset and recovery plans. Co-production and true partnership working with carers to restore essential services which support them to transition back into some form of normality as lockdown eases and while COVID-19 remains present. We need therapeutic interventions for carers to support their mental health and emotional well-being so that if they choose to, they can continue to provide care. Cross-departmental working to support carers is vital at this time. Whilst carers generally sit under the umbrella of health, they're involved in every aspect of our society, from being part of the wider workforce to reaching their full potential through our education system. We need to see the Department of Health working collaboratively with other departments, including the Department for Communities to address the financial impact of caring during COVID, the Department of Education to support our young carers, and the children and young people within our education system who have additional needs and who are not being fully supported at this time, and with the Department for Economy to help employers better support their workforce who are trying to juggle work and caring responsibilities. More needs to be done to ensure family carers have access to relatives in care homes, particularly at the end of life, and that those bereaved during the pandemic are supported to deal with their grief. We need to see increased offers and uptakes of carers assessments through health and social care workforce training and wider public promotion of caring and carers assessments. Contingency planning is key to the assessment process and should be encouraged widely so that if anything happens to the person, the main carer, a plan is in place to support the person being cared for. Many of these issues have always been around for carers, but COVID has hugely exacerbated them and has shone an even bigger light on the vital role carers play in society. They are undoubtedly the backbone that holds the health and social care system in Northern Ireland together. Therefore, longer term, we need to see new legislation to protect and enhance the rights of carers in Northern Ireland, developed with carers as per the Power to People Report 2017. We need a new cross-departmental care strategy to replace the 2006 strategy, and we need ring-fence funding to ensure the outcomes of this can be fully achieved. With more and more carers struggling to make ends meet, we need to see increased financial support for carers in the form of supplementary payments or similar. We need to work with employers to support carers to remain in work and return to work, and we need greater support for our young carers to ensure they have the life of their own and that they can reach their full potential. The COVID-19 pandemic continues to have a monumental impact on unpaid carers' lives, not only because of the increased amount of care that many are having to provide, but because of the far-reaching effect that providing this care is having on many aspects of their life, their relationships, their mental and physical health, their paid work and their emotional well-being. Whilst there have been some positive innovations in tech-based support for carers, and some carers have greatly enjoyed the slower pace of life during the COVID pandemic, the vast majority have found life significantly more difficult. Winter is fast approaching, bringing with it colder weather and the usual pressures on health services. Worrying about the coming winter period is causing stress and anxiety for carers, many of whom have had no break from caring for many months and are reaching breaking point. The risk of burnout is especially concerning when so many are worried that there's no backup or contingency support available for the people they care for should they get ill. It's important to remember that unpaid carers are just as vital in the national effort to keep those with complex health conditions and disabilities safe during this outbreak and far beyond. Thank you for your time this morning, and we would be happy to take any questions at this point.
Thank you very much, Claire Ann. And I suppose I'm delighted to see you this morning, and by way of declaring the interest that I have worked with many of you actually in relation to carers issues since I became an MLA, and just I suppose to note for members' information that we are working on putting together an APG on carers, and it would be great to see all of you there. I think your presentation, Claire Ann, has just kind of crystallised the extent of the impact that COVID-19 has had on carers. I think we probably do have an awareness of how under pressure carers were anyway before it came in, but the particularly unique impact of COVID in relation to services closing, family members not being able to attend, social outlets becoming non-existent, created a kind of a perfect storm for carers in a way. And I have to say, I would be very disappointed that there hasn't been more support offered to carers, and I think that's something that we really do need to get to grips with. As you say, we're coming into the winter period. I am particularly concerned about mental health issues as well, and young people in particular. And it was interesting, and I suppose something that was very useful to highlight the fact that how many additional young carers have been kind of brought forward into a caring role as a result of COVID and no other services being available. And that's probably unquantified at this stage, but if you do have any idea of numbers in relation to that, it would be useful to know in terms of how many young carers have been impacted. The other issue that I think, and this is my question, is around the day centres and the respite services. Is there any engagement going on with the Carers Coalition at present with the Department, or are you aware of any work being undertaken to address that issue urgently? Because I think carers are at significant risk of breakdown in terms of coming to breaking point in their caring role. I'm acutely aware that day centres have only partially reopened. There's something of a postcode lottery in how that's operating. I also know of at least one trust where actually their own carers forum has been recently suspended or stood down, so that's worrying as well. But is there any ongoing work in relation to the day centres, Claire Ann, that's being done at present? Or if they're not reopening, what alternatives are being put in place to provide some support?
Yeah, there has been a little bit of engagement. Obviously, we've been working with the Department of Health for a number of months throughout this pandemic. So there has been engagement there. I think the issue tends to be more on the ground, and perhaps Orla might be able to speak a bit more to this effect in relation to individual health and social care trusts are taking slightly different approaches. And as you rightly said, Colin, it's very much a postcode lottery at the moment. Orla, I'm not sure if you want to maybe come in with some of that. I know you had some key points from parent carers particularly.
Yes, thanks very much, Claire, and thank you, Chair and members, for inviting us to share some of the parent carers' experiences. In relation to day centres, Chair, really, and other out-of-home respite supports for adults, particularly with disabilities, I'd agree with Claire Ann and what she's hearing from parent carers is that each health trust is taking a different approach, and it is in the historical way of taking a top-down approach, so informing carers of what will be available to them. And I have one particular parent carer who has been very frustrated because the number of young people or adults who are attending day centres have been broken down into percentages. So we can have percentages of hours of care in particular day centres, and the trusts are sort of leaving it to the day centres as well. So it's parent carers really are the last to hear what is available, when the time is going to be increased, if it's going to be increased, and based on restrictions coming down very necessarily as the OR rate changes. Again, parent carers are the last to hear what's available, and our children are very, very intolerant of change, if you like. They've had to tolerate an awful lot of uncertainty over the last 9 months for a lot of children. Some children with special needs who are still not in school, or adults with disabilities who haven't had their domiciliary care packages reinstated, or getting access to day centres. So from the parent carers experience, which is where we come from, communication, and I know this of my colleagues here will speak about this as well, communication and involvement of parent carers during the pandemic for the emergency response, and also in planning for us to live with the COVID-19 in our communities. It's just really not happening in any sort of consistent manner, and we believe that's because it's an absence of leadership within health and social care trusts, particularly for children in the education authority as well, to actively involve and seek out carers and parent carers to get their expertise into the plans moving forward. So it depends on who you speak to, Chair, in answer to that question. Parent carers about their experiences of it. Obviously some have had very good experiences, and some facilities and services, and particularly schools, have really gone over and above, working 12 hours a day and working weekends and that sort of stuff to try and ensure that the children, young people and adults with disabilities and their carers are not or to try to reduce their isolation. But, you know, it's very ad hoc. There's no consistent support for those organisations to do that. They're being left really to do it on their own, and no additional resources either, particularly coming towards them. So I hope that answers your question.
Yes, it does. I suppose it does answer the question. Yes, I suppose it doesn't address the concern which we all, I think all of us continue to have. But thank you for that. My other question then, before I go to members, was just on the direct payments that were mentioned there and flexibility. And I know the Minister has committed to looking at flexibility in relation to direct payments. Has there been any progress in terms of providing a framework of flexibility so that direct payments can be used in other ways where carers are unable to use it in the traditional way as a result of COVID? Has there been any progress on that?
We haven't seen anything directly. Now, in the latest carers guidance issued by the department, and actually worked collaboratively and co-produced with organisations such as ourselves, it does state in that, you know, that they're encouraging the trusts to use the flexibility. I think the issue is that, as I said in my sort of opening statement, it's not necessarily happening that way on the ground. You know, every trust is doing, again, it comes back to the postcode lottery issue, Chair. Some trusts are doing maybe offering more flexibility than others, and actually right down into individual social workers. It's not even just as an overarching issue, it's individual social workers as well. It's varying just even within trusts. So there's been guidance, obviously, has come out to say, as part of that unpaid carers informal guidance during COVID, to say that there should be flexibility, and the department are encouraging trusts to be flexible in their approach to it, but actually on the ground it doesn't appear to be happening too often.
Okay, thank you. So I'm going to go to members and I'm going first to our Deputy Chair, Pam Cameron.
Thank you, Chair, and thanks Claire and panel for your attendance here at committee this morning. And I suppose just to say from the outset, we do fully recognise how much we owe to thousands of carers across Northern Ireland for the incredible work and the vital support that they're doing and looking after loved ones, friends and neighbours. And we do absolutely recognise that there's a duty on all of us to ensure that the right financial and resource is there for you, and understand it's a difficult time. My questions to you would be, could you give us your view on and outline what essential services should be prioritised as part of the reset of health and social care, and to what extent have community and voluntary providers been able to plug gaps in support if that has happened? And my other question would be, the carers that you represent, are they currently getting access to mental health support, and to what extent are respite and short break services currently operational?
I'm happy to take the first part, and then I'll maybe pass over to maybe Valerie for the second part of that. Just in relation, Pam, to the prioritised areas, I suppose the main thing is going to be the reopening of services and supports for people with learning disabilities, physical disabilities, older people who may be attending these day centres. That should definitely be a priority area. The community and voluntary sector has plugged a lot of gaps, you know, right down to grassroots, you know, community organisations, GAA, Girl Scouts, the whole lot. Everyone has sort of chipped in at the community level. And there's been a lot of projects going on. I know NEAP, for example, the New Centre and Age Health Partnership is one that has been doing a lot of work on the ground, delivering food parcels to carers who were shielding and who maybe couldn't get out of the house to access any food or things like that. Prescriptions have been dropped off, medications have been supplied. they've been doing those sort of projects on the ground and really plugging that gap. I think the community and voluntary sector need to be recognised for the work that they have done during this pandemic to support not just carers, but the vulnerable in society. They've really picked up the gauntlet in that. Valerie, I'll maybe pass to you just in relation to the mental health supports.
You're on mute there, Valerie.
Sorry, is that okay now? So Pam, just to talk a little bit about the mental health support to carers, there has been, there's a lot of material that is emerging to show the psychological impact on being a carer during the pandemic. And I don't think it would be a surprise to any of us that it's very much in line with what one would expect if someone is stuck inside during a period of lockdown with someone who is unwell and requiring 24-hour care. So there is a very big psychological impact to be dealt with. In terms of what is coming out of the department at the minute, there has been some discussion and there's certainly a recognition that there needs to be further support in place. But in real terms, we don't have a framework in place as yet that is providing tailored one-to-one person-centred psychological therapies for carers to support them with their own mental health. There's been a really big response from the Department of Communities in terms of having online materials available and giving people, signposting them to what you might call self-help options, looking at the Public Health Agency's 5 Steps to Wellbeing, all of those kind of interventions. But in terms of real hard-end psychological supports for carers, those aren't coming through as yet that I'm aware of.
Thank you.
Okay. Thank you, panel, and I'll go then to Paula.
Thank you very much, everybody, for your attendance this morning. My first question relates to those people who care for children who are clinically extremely vulnerable, where they are still not comfortable even sending their children back to the special educational needs schools, and it's really just to protect the sort of family bubble. But the downside of that, and they recognise this themselves, then that they're not getting access to the likes of the therapies, for example, physiotherapy. Is there a potential solution out of this? Because I know people want to protect their child, but they also recognise that there's potential harm in keeping them secluded.
Is that okay if I take that answer, Claire, Chair?
Go ahead, Chair.
Thanks very much, Paula.
Yeah.
Hi, thanks very much, and thanks for your question. Yes, I think it's mainly around return to school that you're asking, and our experience would have been, as Claire has said, as parent carers of children with special needs, and some of our parent care members obviously have children with very complex disabilities. There is that balance that they have to strike between the risk of infection, and most of our children would have higher risk of respiratory infection, and respiratory infection obviously can be devastating to them because of their underlying health conditions. A lot of them have neurodegenerative conditions, which mean they progressively get sicker and their needs increase as they get older from quite early in childhood. So it has been a juggle for parent carers to decide that. It is a fact that there are a number of children that still cannot access they have vital health therapies in school because of the risk of infection, and that's a decision that has to be made between the medical supports and the parent, but ultimately it's the parent's decision whether that happens. Often some of our children, the vast majority of our children, have younger siblings who for the same reason are not being able to attend nursery and school, and older siblings as well because of the risk of infection they might bring back to their very vulnerable brother or sister. So unfortunately, over lockdown, and there was very powerful testimony or evidence given to the Education Committee on the 22nd of October by the National Autistic Society and the Evangelical Alliance and parents within those organisations who described services, particularly school, being whipped out from under their child overnight. And that was 9 months ago, and nothing's been resumed. And just to make the point that school attendance is not just about education for children with special needs, like you say, Paula. It is access to vital health therapies, which in fact allow these children to access the curriculum, which is their basic human right under the UN Convention. And without those therapies, they can't access their curriculum. But it's also the emotional support and challenge of social isolation that you get from connected with your school community, who know the child and share in the care of the child with the parents. Absolutely. So the experience has been that with the withdrawal and closure of schools, and we're not just talking about special schools here, there's a huge amount of children with special needs who don't deal very well with unpredictability in mainstream schools. And that's the way we're going, of course, is inclusion of all children, regardless of their learning difficulties, in mainstream education. They have had all of that routine and all that certainty and all those therapies access removed as well. So it's not just special schools. And again, the Education Authority has unfortunately failed to provide any alternative in home-based setting. For example, online learning, the vast majority of our children have communication difficulties or are actually communicate non-verbally. They cannot access online learning. Blended learning is just not possible for those children who are of a level of academic engagement that can. It's incredibly stressful. And some, obviously, on the other hand, have found it very good not having to deal with very stressful social environments and work out the rules. But the vast majority of those children have found not having access to their education and the therapies that they need to access the education really, really difficult. Parents are left in an impossible choice. And I'm thinking of one particular family where all 3 young children in the house, because of the complex disabilities of one child, have been out of school since February. And there has been no very limited intervention into the house, again, even through domiciliary care or support from organisations like the Northern Ireland Children's Hospice, into the house because of the increased risk of infection and the mother's fear that will cause, that's a risk that she can't take. So I suppose, again, in relation to what Pam's question was around parents' main priority for renewal of services is and particularly getting children access to school. Children, many parent carers see school as a mental health intervention on a daily basis for their children. Children with special needs, specifically those who have non-verbal communication, are often forgotten about, that they can actually have mental health issues and huge anxieties. Despite global pandemics, most of their life they wake up in the morning anxious. And this is the priority of their parent carers, is often their mental health. Children and Young People's Strategic Partnership have been trying to do needs assessments around, and the community's priority would be mental health services for children and young people with disabilities. And just to finish, the Children's Commissioner's report, Still Waiting, in 2018, which reviewed child and adolescent mental health services, found that children with disabilities, communication difficulties and who are non-verbal cannot access mental health services as they are currently formed, because you need to be verbal. You need to be identify that my emotions are in distress here. You need to be able to recognise your emotions and then tell a trusted adult in order to access mental health supports. And that currently isn't available to the vast majority of children. So mental health, but also access to school is a real conundrum, Paula, that no one is approaching parent carers at the moment to try to solve. And I would believe that our priority is that you need to involve parent carers and carers, like Claire was saying, moving forward, or we're not going to find any of these answers. Thank you.
Thank you.
And just a quick second question that was relating to the Chair had alluded to the correspondence we'd received from the Health Minister talking about support for carers who work in the public sector, and I'm just wondering, has anybody got any thoughts on how we can better support carers who work in the private sector, who maybe have a different ethos and different focus? Thank you.
Yeah, so approximately about 15% of the workforce in Northern Ireland are juggling work and care, and that was pre-COVID. And we fully expect, after everything is done and dusted with COVID, that we'll see an increase in that. We do certainly have seen an increase on calls to our advice line from people who are trying to balance work and care. What we would say is there is a lot of resources out there for employers, whether you're from the private sector, public sector, whatever sector you work in, to try and encourage you to be more carer-friendly employers, I suppose. There's things that we're trying to push through for at the moment in relation to the likes of flexible working arrangements. Carers leave is obviously a great option, but we have found a recent report from Employers for Carers actually did a survey of their members who had managed to introduce really positive supports for working carers during the pandemic at a time when everything else was going a bit mad, and they were able to offer supports for working carers, and that was through the likes of the flexible working approach, and having those certain days or times of the day that they were able to work. There was extended leave awarded, special leave awarded, carers leave on occasions, and some organisations be able to set up things like staff carers networks. We've started developing a range of, another network, I suppose, of employers in Northern Ireland who are keen to look at how best to support carers who are juggling work and care. And they've started to introduce some of these measures themselves, which is great to see. I think just even for employers to be more aware that they will have people in their workforce who are caring, I think it's vital that they at least acknowledge that. And I think that will go some way towards carers feeling a bit more comfortable about talking about their caring role with the employers, with their line managers.
Would it be possible for me to just come in there as well?
Go ahead,
Paula, I think everything that Claire-Anne has said there, it's 100% spot on. And on top of that, I think we need to recognise that, fortunately for some carers, depending on their circumstances, and especially we would see this with carers of terminally ill people, eventually there may come a point where, the person's condition deteriorates to such an extent that they do have to, whether it's temporarily or permanently, leave work. And in those circumstances, what the priority then needs to be is to make sure, first and foremost, that they have sort of access to adequate financial support, to sort of see them through that. And in that context, I'm sure this committee is well aware, but, what's currently on offer at the minute through carers allowance just falls way short. When you consider that it works out at less than £70 a week for a minimum of 35 hours of care, that's an equivalent sort of hourly rate that wouldn't be accepted in any other sort of job, or, it would violate every sort of employment law, that you can think about under the sun. So obviously that's an issue that existed pre-COVID, but it is something I think that it's a priority area, and sort of moving forward, if we want to look at how we can best support carers, that needs to be part of the conversation, I think.
Okay, thank you. Thank you. I'm going to go to Jonathan, and then I'm going to go to Colin on the phone. And I am just conscious of time, so we'll maybe try and keep it as brief to give everyone a chance as we can. Thank you, Jonathan.
Thank you, Chair, and thanks to the Coalition of Carers and indeed all the carers across Northern Ireland. I think it was mentioned, and it's so true, throughout COVID-19 there has been much focus, and rightly so, on those that are in care, but less so on those that are providing care, in particular in the home. And I think particularly of the decisions that we take in this place and how that can impact or have a knock-on impact on those looking for respite, etc., but feel that that's not available given the current circumstances. One of the standout parts of the presentation for me was actually the contribution of unpaid care, and I look particularly at the value of unpaid care for older people with dementia sitting at 350 million. I think that's something that is not known by the general public as to the contribution carers provide to our society, in particular in that home setting. So I suppose probably what I would say is I support the balanced work responsibilities and also greater means of financial support. So can I ask, in building on the theme of the discussion here today, in your opinion, have trusts and major public bodies granted enough flexibility to carers to take off work? And if not, how can this be strengthened to give these employees greater security and confidence? And does the panel have any insight into the number of carers who are currently waiting on reassessment because of the status of the person they care for has changed during COVID-19, and how many carers are actually waiting on an initial assessment?
Thank you. Back to the panel there.
Thank you for the questions there, Jonathan. I suppose in short, it's not to sound gloomy in the sense that the trusts haven't done. I think they have. There's been really good positive things that some of the trusts have done, with them bringing a lot of their supports and services online in relation to the likes of offering self-care type programs online, which a lot of carers have been able to access. But the question being, have they given enough flexibility to enable carers to work? The answer would be no. Domiciliary care packages, respite, short break provisions just haven't been there. They've been reduced greatly. We know some trusts are operating at between 10 and 20% of day centres currently opening. And that's just not enough. And even where that is happening, it's greatly reduced. I think one of my colleagues might have touched on it earlier. Where you may have had 6 hours in a day centre, you're maybe now only getting 2. And actually, by the time a carer would get the person into the car and drive to the day centre, have those 2 hours, and it's time to come home again. They're not getting. It's not really a break in that sense. So we don't think there's been enough being done. in that sense to give carers that bit of flexibility. In relation to carers assessments, I mean, I have to say the quarterly care statistics report from April-June shocked me. I was quite disheartened to see it. We were led to believe that carers assessments were happening, that they were being done over the phone and by telephone and by video conference, and it clearly wasn't. You know, the fact that carers assessments were reduced by a third in comparison to the previous year. I mean, there's always been an issue with carers assessments. We don't have figures exactly at the moment of how many are waiting on carers assessments or reassessments. But, you know, I suppose the general thought would have been that, you know, in a time of absolute crisis, that they would be one of the first people you would think of to try and support, because they are supporting the most vulnerable in society. We do think that there should be more done in relation to carers assessments, certainly something around workforce training, certainly a bit more around promotion of carers assessments. We do feel that not enough carers know about it, but, you know, to request it in the first place, they ask for it. But again, coming back to my point in the statement, it's not a carer's duty to request a carer's assessment. It is the trust's duty it's their statutory duty to inform carers of the right to have it. So we think there needs to be a bit done on both sides, both with the trust and within the carers community, to raise a bit more awareness on that. The other side of the coin, though, is that a lot of carers do say, well, what's the point in doing a carer's assessment? Nothing will come of it. And certainly one of our things that longer term that we want to see is the legislation brought in line at the very least with the rest of the UK, that when you are offered a carer's assessment and a carer's assessment is carried out, that the result of that action plan will be delivered on. And if it's not, we need to start looking at the unmet need issues, you know, and identifying those and thinking about how we can be a bit more innovative to address those unmet needs.
Thank you.
Sorry, just a very quick point, I suppose, just in terms of a potential solution to, you know, help carers make the balance between work and caring. You know, I think paid carers leave is a direction that we really need to go in. You know, you can look at examples from other parts of the world where this exists, and it makes a massive difference. You know, it'll help carers to look after their own health and well-being. You know, it'll result in better outcomes for the person that they're providing care for too. And you know, I understand to a certain extent that, you know, we may shy away from that because obviously there's a monetary impact. But as you correctly said, Jonathan, you know, the contribution that carers make, you know, to the health system and to the economy, it massively outweighs any sort of potential cost, you know, from looking at something like carers leave. So I really think that needs to be part of the solution, you know, if we want to help those who have paid employment and caring responsibilities when they come home.
Thank you. Okay, I'll go then to Colin on the phone. Colin, can you, are you there for a question, please?
Yes, indeed. Thanks very much, Chair, and thank you to the guys for the presentations. It's good to see you all, and especially good to see yourself, Orla, and taking part in this presentation today. I suppose my question may be moving I know a lot of the people have already responded in terms of the sort of the sort of more general and macro issues about the caring, but I was wondering about the issue of loneliness. I think that loneliness and isolation is something that is going to contribute to a greater mental health problem that we're going to face down the line. And I'm thinking particularly of those maybe lone parents maybe at home that are looking after children, and those sort of young people that are at home looking after family members, and how they're not able to avail of people calling into the house or calling in for that cup of tea and that sort of support that comes to them as carers. And then also to those maybe elderly people in our community who would have had lots of people calling in and out during the day, where the care is just literally a little bit of time being spent with them. And that's not possible because of all the regulations and stipulations that we have at the moment. Is that something that you are aware of and are seeing? And what sort of a response would you like to see to that issue of loneliness?
Thank you.
Thank you very much. Thank you very much, Colin. Yes, loneliness is definitely something that's been on our radar for a number of years now. It's particularly in relation to carers. Recent work that we've done with the Joe Cox Commission on Loneliness showed that more than 7 in 10 carers in Northern Ireland were experiencing loneliness, and this was pre-COVID. And we have seen an increase, and certainly the calls that we're receiving right across our organisation and the discussions we're having with carers would emphasise that is happening. As you rightly say, you know, with care packages reduced, or you know, people coming in and out of the home maybe not as often as would have done before, and you know, up until we had social bubbles, up until we were allowed even that, you know, a lot of carers were just in their 4 walls of their home all day, every day with the person they care for, with no other way out. And that was particularly hard for people that in the likes of rural communities who didn't even have maybe a neighbour just next door to give them a hand with anything. So that's definitely something on our radar. A couple of us within the coalition are involved in work on the loneliness, the all-party group on loneliness as well, and we've got a sort of a coalition, I suppose, developed and work on that. And that's one of the things we would really like to see. We would like to see a loneliness strategy in Northern Ireland that covers everyone, but also particularly for carers, and so that those issues could be addressed. Because as you rightly say, the mental health impact of that, it's going to be a longer term issue. You know, we've got some carers that we're speaking to who have not left their house since March. You know, or if they have, it's been out once or twice to the shop to pick something up essential, and that's been it. So you can imagine that it's not surprising that nearly 2/3 of carers, their mental health has worsened as a result of being at home and cooped up during COVID. So a loneliness strategy is definitely something we want to work towards, and I suppose more awareness of carers in our community would maybe help that. You know, if everyone will know somebody who is a carer. They might identify themselves as a carer, but it'll be your mum maybe looking after your granny, or it'll be, you know, your friend looking after their child with a disability. And I think it's important as a community that we start to acknowledge carers that are living amongst us, and just to check in on them, see how they are, and sort of see what offers support that they can give.
And I think as well, just to comment at the back of that, you know, the loneliness strategy, unfortunately, that's another example of a policy area where we're falling behind our neighbours. You know, England and Wales both have quite robust loneliness strategies, you know, that have been developed within the last sort of few years. And, you know, not to suggest that they're perfect, you know, because it's hard to get that, but at the very least what that does is sort of embed that public commitment to tackling loneliness, you know, at the highest sort of policy levels, and we just don't have that here, you know. And again, I think that's something we need to move towards locally.
Okay, thank you. And I'm going to Arlea, and I just ask the panel to keep answers as brief as possible as well. We are getting quite short of time, so Arlea.
Thank you, Chair. So just maybe to follow on from Colin's remarks there around and Pam's around mental health and loneliness, some of those stats that you quoted, see that 50% or almost half are at breaking point. Like, that is really, really worrying. That's really extreme, and the significance of that shouldn't be lost on anyone. If people are reporting back that they're at breaking point, that is really bad. And I know that there was a programme that was run on Radio Ulster the other day around this issue, and a carer was speaking to BBC Radio Ulster, and he was really open and honest about his experience, and the guy was sounding as if he was losing hope and that it was getting him really, really down. And I think it's reflective of what you've presented in your remarks today. So for me, that's sounding like it's one of the most urgent issues. And I don't know if anyone has had any conversations formally or informally with the Department of Health around setting up some form of psychological support. I know that there is the psychological helplines have been set up for health and social care workers, but maybe could we explore, you know, the demand on that service, which I'm sure there is a great demand, but could that be extended to carers, or could a separate psychological support helpline be set up specifically for carers? But I think that needs to be done as a matter of urgency, and it is going to be a longer term thing that we're dealing with as well. I know that I met with a mental health champion a week or two ago, and I think this issue is on her agenda also, so I'm not sure if you spoke with Siobhan O'Neill, maybe to try and get some support with getting that psychological helpline, or whatever you can get put in place, but just whatever help you can get to try and get something set up. And I'm happy to have a conversation with you outside of today's committee meeting. And then maybe just a question is around older carers. Is the Department of Health putting any provisions in place to support carers at the minute who are in the vulnerable category themselves? Thank you.
Orlia, I'm going to take the first bit of that just to talk about this issue of loneliness and isolation of carers. And you'll be aware that our organisation specifically supports families who are caring for someone who has a serious mental illness. And people with a serious mental illness, the cares of those people tend to be very, very isolated because of the stigma that's still associated in our society. And basically the trajectory is stigma, isolation, loneliness for the carer. And that's really part and parcel of what we would want to see a focus on in the coming years, even through the new mental health strategy. And with the interim mental health champion, Siobhan's looked at this as well. And if we can look at somehow having a big focus in our society on stigma, that would really be the start of focusing on addressing loneliness for carers. Ironically, one of the things that's come out of the pandemic in terms of addressing stigma is the kind of normalising of psychological distress. And that's something that I think we should be working on as well, is that it's okay and it's actually a normal psychological response to feel distressed in the face of a global pandemic. And the more that all of us can talk about our own levels of distress and be happy to be open and honest about the pressures that we feel, that opens the doors. It builds a language in our society where people are able to talk about how they're feeling. And that really is the first strike at dealing with loneliness, stigma, isolation. Outside of that, I think your idea and what you've suggested there about having a bit of a look at how the numbers on the psychological support services for the social and healthcare staff, I haven't seen any figures that would say what the uptake on that is and whether people are finding it beneficial. But it certainly would be interesting to see if that could be extended as a support line in some way for unpaid carers. It would be very interesting to see, and I'm sure my colleagues would agree with that.
Okay, thank you. I'm going to go now to Alan.
Thanks, Chair. Panel, it goes without saying that carers sacrifice many aspects of their own lives, and I think you have to experience it yourself or see it within your own family to appreciate the commitment involved. But would there be a group of carers who, out of a sense of duty, are reluctant to hand responsibility over for the care of their loved ones, even for short periods, to someone else, particularly to someone who may be a stranger? And has there been a piece of work done to try to convince some carers that for the sake of their own physical and mental health, they need to accept third-party support and that it is not a sign of failure or something for them to feel guilty about?
I'm happy to take that if the panel's all right. Yeah, you've raised such an important point, actually, and I think this is quite common for most carers, but especially when you get into the sort of older age groups and you're looking at spousal carers, potentially, there is that real sense of, as Claire-Anne hinted at earlier, I'm not a carer, I'm just a husband or a wife, and this is my duty, to fulfill this caring role and to keep going until the absolute end, until breaking point and beyond, because, that's part of the role, that's what I signed up for. And actually, what I've heard speaking to some carers for people with conditions like dementia, whenever it gets to a stage maybe where they have to look at sort of putting that person into a care home, whether that's for a temporary period or not, they actually describe it, it's almost akin to a bereavement, that, that they feel that they're not just losing that sort of day-to-day contact, but it's almost like being bereaved of the person, just because, prior to that, the caring role was just so all-encompassing. So you're absolutely right that this is a major issue. But in terms of how to get around it, I'm not really sure, to be honest, because that sort of sense of duty and commitment that so many people feel to the people that they care for, it's very hard to break, understandably.
Thank you. Chair.
Thanks, Chair. Thanks, panel. Just two quick points. The first one is obviously, this is work that people carers are doing. It's work, it's labour, and they're paid a pittance, if anything at all, for it. I think it would be unacceptable in many other services that people were paid so little for their work. So does the panel have any views on a wage for carers to recognise the important work that they do for society? The second point in question, I don't know if the panel is aware of this, but something I want to raise with them, and if they heard anything about it, I would be interested in their views. I've heard of constituents of mine who formerly went to day centres, constituents with learning disabilities went to day centres. They were closed obviously because of the pandemic, but when services resumed, the day centres remained closed, and I'm talking about people who went to the White Rock Centre in particular, but they've been forced to go to a different centre in a different part of the city. Expenses coming out of their own pocket, and obviously an extra amount of stress for everybody involved in that. So obviously a tough period already for those people, but harder with having to go to a different centre. I've raised this with the Trust, Belfast Trust already, but to me, I think there's warning signs about this, because there was plans previously to close day centres, and the Trust were pushed back on that. So has the panel heard of any of these concerns, or has anything been raised with them about this? Because to me it seems very worrying, and I'd be concerned if a pandemic is being used potentially to restructure, if not close down, services. Thank you.
Thank you, Jerry. Panel?
Thanks, Jerry. I'm happy to take the first point in relation to the wage for carers, and maybe Orla might come in with some thoughts on the day centre closures. The wage for carers issue has been around for a long time. There are some carers who obviously get carers allowance, but there's only around 50,000 carers in Northern Ireland who get carers allowance. And to go back to Craig's point earlier about the value of that, it's not very cost effective in the sense of, nobody would work for £1.92 an hour over 35 hours a week, and most of our carers provide and care for a lot longer than that. There is definitely a call for, some sort of a wage for carers, but I don't think there's been enough research really done on that and what that would look like and how that might affect other aspects of life as a carer. Orla, maybe you want to talk a little bit about just on the day centre closures there as well.
Thanks very much, Karen. Yes, thanks, Jerry, for the question. We have had actually some discussion among carers about the very interesting thoughts that are coming out around universal basic income. So it might be something you want to have a wee look at, the universal basic income group now in Northern Ireland, particularly people with dependents. Some people have been suggesting might benefit from that, because obviously we've no choice but to give up work as parent carers, because the state can't meet its obligations to provide childcare for children with disabilities, and also in this situation, obviously we're hearing a lot of experiences of services being reduced, like you say, and changed. And I do know that a number of members of the committee have concerns about health services particularly being watered down, changed, moved under the auspices of emergency responses. We have a number of different experiences reported to us during the delivery of our advocacy service, Jerry, which would be similar to that. And again, it's back to what we were saying, what Claire Ann was saying originally about involvement, and what Valerie was saying actually about stigma. Parent carers of children, young people and adults with disabilities, there's a huge stigma against disability in our society, and an assumption in children and young people's health and social care services that parents are passive recipients of care for their children, and there is no involvement, and there are certain specific structural barriers to engaging with parents, which means that there is people with adults with disabilities who are having their services changed around like that are at significant risk of not having their voice and their opinions heard in all of those things, probably because of communication difficulties, but also because their parent care advocates have been silenced. And we can take the experiences of the parent carers at Muckamore Abbey Hospital at the moment as evidence of that. So it's about a cultural acceptance of the unacceptable, Jerry, really, to be honest. Not in every organisation, certainly not in every centre or school, but it's there, and it's purely because there is no mechanism by which those adults can have their voices heard. So it's something, it's much deeper than that. And everybody's under pressure, services are under pressure, but the last people to hear about vital services are the parent carers, the carers, and also the individuals who are receiving care, who rely completely, crucially, on these services to maintain their health and well-being and to help them reach their full potential. So it's about people's attitudes, values and beliefs around day centre services and the visibility of those since lockdown, because who was it, Naira Wood said that crisis is a tide that goes out and reveals who's swimming naked. And parent carers and carers have been swimming naked for decades sometimes before the lockdown. So we're a wee bit more visible now. It's about our invisibility and our silence and our isolation. So thanks for the question.
Thank you.
Okay. Thank you, and thank you very sincerely to our panel for briefing us on that extensive range of issues and for highlighting those concerns. I want to wish you all the very best in the time ahead in relation to your very difficult role in supporting the issues, and I think the committee will want to continue to see what we can do to try to improve the situation both short, medium and longer term. I have to say I think it's a huge job of work for us as a society and as an institution here in terms of the Assembly. So thank you for that, and I wish you all the very best in the time ahead.
Thank you.
Thank you. Okay, members. Just in relation to that, there was a call there at the start of that, and it does strike me that not a lot has changed really. And I'm wondering, would members consider that we ask for an urgent review of carers' services by the department? Because I think there's really a need for action now very quickly. Carers have been stretched right to the limit. I get an impression here. Go ahead, Paula.
I asked the Health Minister last week, you'll recall, around mental health services, especially for people who are carers, and his response was very much around, well, there's quite a lot of resources now online, but I didn't get the impression today that that was actually meeting the needs. Might meet the needs of some, but not far enough, so I think that would be very helpful.
And I think there's a sense of where an urgent review of the needs, first of all, and also an urgent review of the delivery by the trusts, because it seems to be very, very piecemeal. Yep. And the final thing that struck me during was in relation to the motion, the all-party motion, which got good support in the Assembly for an urgent a plan on rebuilding services. Could we ask for an update maybe in relation to that plan, where that plan is at? Members content with that? Okay. Thank you, members. Moving on then to our next session. So we're moving on now to consideration of 3 statutory rules regarding coronavirus restrictions and face coverings. These will be debated in the Assembly in the week beginning 23rd November. The Examiner of Statutory Rules has reported on all 3 and has no issues to raise. I can advise members that departmental officials are here to brief the committee on the regulations and to take questions, and we will then consider each SR in turn as we normally do. I refer members to tabs 6 to 8 of your pack, and there is also relevant replies there from the Minister regarding issues previously raised at tabs 6.4 and 6.5. So I'd now like to welcome by video link Mr David Hughes, who is a Director in the Department of Health, Mr Jonathan Boyd, Principal Officer in the Department of Education, Miss Linda Buick, Principal Officer in the Department for Infrastructure, and Miss Liz Redmond, who is Director of Population Health in the Department of Health. So I would now like to invite you to please go ahead and brief our meeting this morning, and my understanding is that David will brief us on numbers 232 and 239, and then either Jonathan or Linda will brief on 233. So could I ask you, David, to go ahead on the 232 and 239? Thank you.
Yes, thank you very much. These 2 sets of regulations are amendments to Amendment number 9 regulations, which are the restrictions that were put in place on the 16th of October. So the number 11 and number 12 amendment regulations are relatively small-scale amendments to those 16th of October restrictions. The number 11 clarifies the meaning of self-catering accommodation where it's referenced, and also includes hostels and similar establishments alongside hotels. This is to follow the language used in existing tourism legislation to ensure clarity. There is also an inclusion which allows for individual exercise to be taken by somebody who needs a carer or carers to accompany them, which had been made impossible by the previous drafting. This is just for clarification. And it clarifies later on that references to caravans also relate to motorhomes. Finally, in the number 11, there's a provision to allow for close contact services such as hairdressing and makeup to continue where they're in the context of film and television production. The number 12 amendment regulations simply allows for physical education to take place in schools, which again, the original drafting of the number 9 regulations had prevented. And also ensures that where premises adjacent to hospitality premises provide seating, that had already been captured in the restrictions, but it has been pointed out that it also needs to include other facilities apart from seating, so coverings and so on, allowing people to congregate outside hospitality premises. That then was just captured in a small amendment in the number 12 amendment regulations. That actually is all that these amendment regulations do, and I'm happy to take any questions or clarify any points on that.
Okay, members' questions in relation to that. I'll go to Jonathan.
Thank you, Chair, and I'm not going to rehearse a lot of probably what was said in the Chamber last week, given my opinion on the generality of the regulation. I suppose probably it makes it even more ridiculous today, the fact being their retrospective nature, that they essentially expire tonight. So I suppose probably my point will focus on a technical matter in terms of the regulation in itself. These rules relate to supplementary changes to regulations, and I think the PE issue has highlighted the need for greater consideration of the ramifications of this legislation and the pace in which it comes into effect. What can we do to make the original regulations more effective from the get-go and avoid the need for technical changes, as we're seeing such through these regulations, coming to a committee for scrutiny on the very day that they would expire?
Well, I think it's worth bearing in mind that when preparing regulations in any sphere, the process it would normally take place over weeks, if not months, and there would be many stages of ensuring that all possible consequences have been fully bottomed out. The regulations that were made, and these, as you say, these are amendments to the number 9 regulations made on 16th of October. The decisions taken in respect of those regulations were taken only a few days earlier, and it's simply a matter of the speed that they had to be prepared and the number of areas of life which they touch upon. The sheer scale of how the effect that they're having means that some of the consequences of the original restrictions would not necessarily have come to the fore in the process of getting the regulations drafted. As it happens, for example, the PE one, when it was spotted, then the number 12 regulations came into place as quickly as it was really possible for it to happen. And it is simply a case that these restriction regulations are having to be made at such extraordinary pace that there will at times be occasions when specific issues are not immediately identified. To do it differently, I think in normal circumstances, of course, we would all want regulations to be made very carefully in conjunction with all the relevant stakeholders and for a very a proper process of examination of every line to ensure that they're completely effective before they're made. But in the current circumstances, of course, we are having to move very quickly. And I'm not sure whether there is an easy answer to how we could do it differently in the current circumstances.
Just to follow on with that and briefly, what is the level of cross-departmental consultation before a regulation such as these are made? Because it strikes me as this is something that should be flagged up quite early in the process, given its cross-departmental nature.
Yeah, well, there are there's a cross-departmental group that meets every week, drawing in people from every department, I think every department, with an interest in the COVID restriction regulations and other regulations, and generally about the approach to the coronavirus restrictions. For the most part, there may be 1 or 2 representatives from each department. And even then, the speed with which the regulations have to be made does not necessarily mean that everyone spots everything, as we can see. And I think that's understood. And we would love it to be the case that we get everything right at the first instance. It's also worth bearing in mind that it has to be a two-way process in the development of the regulations, in that those of us who are working on the preparation of the regulations need to know from departments what the issues are that may be arising. But those departments also need to know from us who are preparing the regulations what the policy intent is and what the intention is on what needs to be restricted. And that will sometimes depend on absolutely crystal clear policy direction from ministers and from the executive who've taken that decision, but the executive's decision may not in every instance have touched upon every single detail. So there is then a process of establishing whether the principles behind the executive's decision can be applied in a very minute way, or the lead policy department may not know of an instance which the regulations cut across. So last week I briefed on the number 10 amendment regulations, which amongst other things allowed for caravan parks to be used in an emergency. And that came to light because a district council literally phoned up and said, we have families who are in a caravan because they've been burnt out of their house. We didn't know that, and we wouldn't necessarily have known that that was something we needed to address. But that then is something that had to be addressed.
Okay, thank you. I'm going to go then to Pam.
Thank you, Chair, and thank you for your attendance at committee today. I suppose just to say from the outset that I certainly completely appreciate the nature of these emergency legislation, and it's kind of, it seems to be really firing back at us now after all these months. It's more kind of wearying week on week when we're talking about rules and regulations which really are about to expire or have already passed. So it is quite frustrating, but I understand where the department's coming from that as well. I suppose just a quick one for you. I'd certainly be interested to learn what the process would be should, for instance, the requirement for children to wear face covering on public transport after today be retained.
Sorry, Pam. There's someone there maybe needs to mute a phone on our panel. We're getting some noise. And Pam, also, it may be we're doing the face mask one as we'll have a briefing on the face mask one. So we'll bring in whoever's briefing. But if you have a question for David on the face mask, that's fine. But
okay, we'll see if David wants to answer it. But I want to ask if that was the case, if we're going with continued wearing a face mask in that particular instance, are fresh regulations then required come tomorrow?
I'm sorry that I'm not able to answer any of the points on the face mask regulations. It may well be colleagues who are talking about those ones will be able to answer that point.
Okay.
yeah, and I had specifically thought it better for members to address their questions to you, and then we'll go on to face masks. So just to make that clear to members, so we'll deal with these 11 and 12, and then we'll go to the other one. So okay, Pam, going then to Paula.
Thank you. I'm just going to follow up on Jonathan's question there around cross-departmental consultation in terms of regulations, and I'm specifically focusing on the outdoor seating outside businesses. I was contacted at the weekend by a coffee shop owner on the Ormo Road who is further on up the road from a new, what's called a parklet that the Department for Infrastructure has introduced outside some coffee shops. And the businesses are not at fault, and the residents themselves aren't necessarily at fault either, but the other business told me that there was 30 people sitting on the sort of bench of this new parklet, which in many ways it's not anybody's fault except maybe the fact that the Department for Infrastructure has introduced this in the last 6 weeks. So I'm just wondering to what extent these regulations then would cover where departments are not protecting their own infrastructure, so to speak, in areas where they're actually allowing people to congregate, if that makes sense.
You're on mute there, David, sorry.
Apologies. I think I just want to go back to the number 9 regulations where this reference to seating is made. And the reference there is where seating is made available for customers. And I think we can draw a distinction in real life between a coffee shop that leaves some garden chairs outside, that helps people to stop, and a coffee shop that just happens to be outside, happens to be opposite a set of benches. And I've been through the city centre and have seen this and can make a clear distinction in my own mind. I recognise that it is possibly not helpful in the restriction upon the public from congregating after having bought a cup of coffee if there is a row of benches immediately opposite a coffee shop. That then takes it is for individual responsibility to prevent that becoming a congregation of people. It's not then the responsibility of the coffee shop. I think what the restriction regulations are seeking to do is to ensure that business owners are not finding a loophole over the restriction on their premises by allowing congregation adjacent to their premises. Is that the distinction that you'd recognise?
No, I do recognise that distinction, and I say I'm not blaming the businesses nor the people who are sitting on it. My point is the timing, in that this parklet with the benches have only been introduced in the last few weeks. I think it was about 6 weeks ago, and I suppose it's that mismatch between what the Department for Infrastructure are doing and maybe what the Department of Health are doing in terms of these health protection regulations. So in many ways I'm maybe just more flagging it up for you, that it's maybe something that if they're rolling this out in other parts of the city, that they maybe should cease at this stage.
Thank you. Thank you, Paul. Yeah, thank you, Dave. I'm moving on then. I'm going over to the phones, and I'm going to Colin there. Has a hand raised on the phone. Are you there, Colin?
Yes, indeed. Thanks very much, Chair. And again, Chair, through no fault of anybody in the committee and no fault of any of the people that are presenting, this is another example of us having a wonderful conversation about something, but it's not going to achieve anything because, as has been pointed out, the regulations that we're discussing expire tonight. And I suppose maybe if I could go to the panel that are there, it sort of just came to me that you're the experts. You're the civil service top level. David, you highlighted there that this process would usually be used to try and examine legislation, and that it would be a process of months, maybe even longer. But on this occasion, we are using it for something to be done in a very short period of time and is time bound and then has an impact. So what would be a better method for us to be able to raise issues, the executive to introduce legislation, for us to have an input to that?
Yeah. Go ahead, David.
I think in the current context, I'm not sure whether there is necessarily an obvious better way of doing it than this, where the decision-making process has to take place very close to the point at which the new regulations have to be in place. In that case, there will necessarily be a very short space of time between a policy decision being taken and the regulations being put in place. And whilst officials can work as hard as they can to ensure that the regulations cover all bases and fully reflect the policy position that has been taken, we have found inevitably there will be some gaps. And fortunately, in a way, we have also equally speedy methodology for plugging those gaps. And I think if we were to have a slower process of developing these regulations, we're less likely to have gaps, but we would also have a very slow process of amending or adjusting or developing those regulations as circumstances change. And of course, we're in an environment where circumstances are changing constantly. And that is why decisions are taken as close to the point at which the decision needs to be implemented as possible.
And maybe, Chair, just to ask a second question, David, would you be aware of what the process is in Scotland, Wales, or in London? And are they following a similar process to what we're doing here? Or are you aware if they have different processes or a different alternative to what we are doing here?
I must admit, I don't know the detail of how the other jurisdictions are operating. I think my recollection is that certainly in Westminster, they have worked in a very similar way to this, but that has changed. But I apologise not being able to say that confidently. I'm not absolutely sure what the different processes are.
Okay, that's great. And maybe, Chair, that's something we could ask the Assembly research team to do, is maybe to come back with a short piece of research telling us how the other jurisdictions are managing this, just to make sure that we're utilising the best possible way of doing that.
Yep. Okay, we'll put that in as a proposal after the session. Thank you, Colin. I'm going then to, and I suppose I just do want to say that while undoubtedly, and I recognise the frustration around us discussing regulation and amendments that have now expired in some cases, to me, I would hope that the learning and the lessons that are being learned as we go through are being dynamically built into the situation. So I would hope that there's some value in that sense. Anyway, going to Jerry.
Thanks, Chair. I suppose a general point about going forward, I think it needs to be raised. I mean, all regulations that come to us are basically deemed to have no equality issues. You may be aware that this morning the Policing Board questioned whether the PSNI approach in response to the June the 6th Black Lives Matter protests were questioned whether their approach was lawful, and have called for a review of all the fines. That's the Policing Board. I want to ask, what is the equality screening process before these regulations are drafted? Are they fit for purpose? And I suppose just to detail what they are, because it's pretty stark if the Policing Board is questioning whether the PSNI approach was lawful on that day. It should ring massive alarm bells for the department, and it appears to me to be more than just gaps or an oversight, and points to structural problems with possibly these regulations, as well as structural racism in our society. So a question on that, please.
Certainly, you'll know, as you say, there has been no formal impact assessment prepared on each of the regulations as they're developed. However, in the development of the policy and the regulations which flows from that, the proportionate nature of what restrictions should be put in place is inevitably a large part of the thinking and the consideration before final policy decisions are taken. And it will be a matter of balancing the impacts on rights generally with the impact of not placing restrictions of these sorts in place, and the impact then on life, given the nature of the pandemic.
Just a quick reply. I mean, it's quite stark, really, that answer. I mean, we have a fundamental question about the approach, whether it was lawful on that day, and I haven't heard from any of the panellists what the process is to make sure regulations are a quality screen, what they are, any commitment to relook at them in light of this news. This is pretty big stuff, so I would like that to be taken away and to be looked at further.
Can I add that the consideration of the impact of restrictions and the nature of the restrictions in particular in light of human rights is and has been part of the consideration, but I think there's a recognition within the department of the need for a more granular consideration, and that how that can be done and how that can be done most effectively is something that's currently being investigated, and we'll be working with DSO and with others to look at how that can be done, so that there can be some assurance that it is not simply let's stick in a line that there has been no assessment and move on. That shouldn't be the approach, but rather we recognise that we are treading a very careful line here, and we want to be able to demonstrate that it's not haphazard.
Okay, thank you. Alan?
Thanks, Chairman. I mean, these collective policy decisions of the executive are obviously taken to restrict the transmission of the virus and therefore to ultimately save lives. And you have the responsibility then of putting those policy decisions into legislation. Is it fair to say that any undue delay on your part, or indeed the Assembly's part, in delaying putting them into legislation could actually result in loss of life?
Yeah, go ahead, David.
I'm not sure. I'm not sure whether I can give you an assurance, but my understanding is that whenever a decision has been taken, it has always been taken with a margin between that decision point and the actual implementation of, say, a new set of restrictions. That's not simply to ensure that the regulations can be drafted. It's to allow the communication with all those who need to understand and adjust what they're doing to the new restriction requirements. As far as I know, and I haven't been involved with this work from the very start, but as far as I know, the regulations have always been ready to be put into place at the point at which they are needed.
Thank you.
Okay, thank you. And Leah.
Yes, thanks very much. I'm conscious of what other people have said about the timeline of the regulations brought in, but as the Chair also explained, the hope is that any conversations that are had at committee level will help improve the regulations if they need to be brought in at a future date or amended at a future date or whatever. So just on the issue around the caravans and the use of mobile homes if a family's in an emergency, you use the example of a family whose home have been burnt in a house fire, so they require use of the mobile home. And it's really just to ask, how do you verify or manage, what an emergency is? So how can you control that? Get the house fire is legitimate, but how does the regulation of the department control or manage that?
Let me make sure I've got the right expression. Excuse me, just one moment. On caravans, sorry.
You're okay, David. Take your time.
And I'm sorry, David, my battery went on my computer as well, so I haven't got it.
Right. Well, my point is, my point would be the same. Is that of course we cannot prescribe every possible instance, but I think it's going to have to be a case where there would be a common sense understanding of what an emergency would be that would require somebody to stay in a caravan rather than in their home. There have been, I'm sure, occasions when the regulations have tried to identify in considerable detail the different circumstances in which something might be allowed. The risk with that is that there is always one example that you hadn't thought of, or which is a perfectly fair thing and doesn't appear to be considered. And I'd note that in the number 9 regulations, for example, there is a restriction on overnight stays unless somebody has a reasonable excuse, and reasonable excuse will include, and then there is a list. But it's also the case that because it says reasonable excuse will include, there may well be other things which are also a reasonable excuse. And I think that is simply going to have to be a matter of the interpretation of the regulations in individual cases.
Thank you, David.
Thank you, and thank you. So I'm going to go across then to either Jonathan or Linda to brief on 233, please, and then we'll take some very quick questions on that. So who's briefing there? Yeah.
I'm going to lead off. Can you hear me? Okay.
Yep, we're hearing you there. Okay.
Liz, Department of Health. Yeah. Okay. Thank you. Thanks for the opportunity to come and talk to you today about this. So I'm going to begin outlining the changes contained within the new amendment to the face coverings regulations, and then I'll hand to Jonathan Boyd from the Department of Education, and then he'll hand to Linda Buick from the Department for Infrastructure to provide the rationale behind the decision to mandate the use of face coverings in the context of school transport particularly. So the Health Protection Coronavirus Wearing of Face Coverings Amendment number 3 regulations, Northern Ireland 2020, were made at 5:30 p.m. on the 29th of October and came into force immediately. The Department of Education and the Department of Infrastructure's policy objective was to have the regulations in place before school resumed on the 2nd of November. So it was not possible to enable committee consideration in advance of that. The purpose of these amendments is to mandate the use of face coverings by post-primary pupils on home-to-school transport and on public transport. Previous amendments to face covering legislation had extended the requirement to use a face covering to all buses, coaches and taxis. An exemption existed for children under 13 years of age. Amendments to the regulations therefore were needed so that only children who were not yet at secondary school would be exempt from wearing a face covering on school transport or public transport. In drafting the amendment regulation, the Department of Health sought to use definitions and terminology from existing legislation where possible. The amendment substituted the exemption that existed already for children who are under the age of 13 to replace that with junior pupil not yet receiving secondary education. The term junior pupil is contained in the Education and Libraries Northern Ireland Order 1986 and means a child who has not attained the age of 11 years and 6 months. However, the Department of Education wished to specify that children at primary school should not have to wear a face covering. So therefore, the term junior pupil not yet receiving secondary education exempts children under 11 years and 6 months who are not yet at secondary school from wearing face covering. The exemptions that already exist in the regulations remain unchanged for medical reasons and others. So I think that's all I was going to start with, and I'll hand now to Jonathan Boyd, Department of Education, to pick up from there.
Thank you. Okay, Jonathan. You're on mute, Jonathan. Yeah, we're not hearing you there, Jonathan. Just can you check that your system's not on mute at your end, Jonathan, please? Go ahead there, Jonathan. No, we're still not hearing you, Jonathan. Is there an on-off on your headset? We're not hearing you, Jonathan. We're not hearing you. Linda, do you feel you could take questions in relation to that, and we'll come back to Jonathan?
Yes, certainly I can give the DFI perspective on this. So from DFI, I suppose, as you know, face coverings were made mandatory on public transport for all passengers aged 13 and over from the 10th of July. So after the introduction of the requirements, TransLink reported that the wearing of face coverings by passengers increased from about 10% up to 85% across all services. So as you know, the requirements when they were introduced included an exemption for school transport. So after the return of schools, TransLink were highlighting concerns about low numbers of school children wearing face coverings, both on public transport where they were mandatory and on school transport where they were strongly recommended. And those concerns were echoed by parents and members of the public through correspondence to the department. So in light of the increase in the positive case numbers and with the view that maybe steps could be taken to increase the level of compliance by school children, Minister Mallon was fully supportive of removing the exemption for school transport and introducing a uniform approach to the mandatory use of face coverings both on public and school transport. And she was also fully supportive of changing the requirement from the age of 13 to all post-primary school children, as that would help provide clarity for young people. And it would also make it easier to identify those young people who should be wearing a face covering so that education and encouragement efforts can be targeted appropriately.
Okay, thank you. I'll just check with Jonathan there very quickly. Can we hear you, Jonathan? No, I'm going to go to members' questions. And members, can I just emphasise, this is the section on face masks, so I'd like questions specifically on this. In terms of general process issues that have already been dealt with by David, by questions, we'll not go over those again. So have members any questions then for the panel on the face masks? Paula.
Thank you. Mine is in relation to the more general issue that I raised last week about the blanket application of the wearing of face masks. And if you look at the Department of Health's key graphic, they talk about keep distance, wear face mask, wash hands. We then received a letter following last week's meeting, and I think that was contradictory in parts. And so I'm just wondering, has there been any update in terms of the discussion around wearing of face masks? Because this is another amendment that actually introduces new rules and peculiar aspects of it. And and I think that a more general approach to just wearing face masks indoors would actually be easier in terms of compliance.
Thank you, panel.
I'll take that.
Yep.
Yeah, thank you for that feedback. I think the difficulty with applying this to all indoor settings is that there are some indoor settings where it would actually not be appropriate to have people with face coverings, particularly if people are in these settings for prolonged periods of time. So it's felt that that could actually be counterproductive. So we've tried to be quite targeted in where we've mandated this, though continued with our advice that people should consider using face coverings. There's also still settings where there can be gatherings of larger numbers of people where the regulation still applies around risk assessment, and it might be that part of that risk assessment indicates that a face covering would be an appropriate measure for the organiser of that gathering, whether it be an place of employment or education, would advise that face coverings should be worn. So this will be constantly kept under review, but at this stage, the science isn't telling us that that is the best approach to take at this point in time.
Okay, thank you. Jerry.
Just quickly, we got correspondence about the face mask working group. I've said that correctly. Can you tell us who's on it and how many people from different departments are on it, please?
I can certainly get back to you on that. I haven't got a list of the attendees, but I know it is a cross-departmental group that is chaired by the Executive Office.
Thank you.
Okay, Jonathan.
Thank you, Chair. And given that when we look at these regulations, the face covering ones that we're looking at the moment, we see no public consultation, no equality impact, no regulatory impact, and we understand because of the speed why that is the case. Has there any consideration been given, and I particularly think of schools, where potentially young people who are not as publicly aware of the hygiene element of wearing a mask and the proper use of wearing a mask, that potentially there could be counterproductive in terms of the spread of the virus? Has there been any work carried out into looking at the impact of improper use of masks?
Panel.
Yeah, that's a very interesting question. Certainly, I asked these questions early on our journey on face coverings, and my understanding is that the science that points towards the net benefit of face coverings in certain settings builds in an element of human behaviour that means that it's not ideally applied. So that is my understanding. So in terms of very specifically looking at the impact of improper use, so we know that improper use might cause virus to be transmitted from mouth to surface, and also it might in fact cause people to have a false sense of security. I'm not aware of any specific studies around that, but certainly it's something that we can ask the Chief Scientist to be on the lookout for.
Okay, I would appreciate that, because I have considerable concern that with mask use now probably becoming more an issue for people to ensure that they're covering a regulatory requirement, that the dangers also have to be assessed regarding the potential transfer of the virus by a surface not clean, touching it with hands, reusing the same mask over and over again. I think these are things that really have to be given careful consideration to, because we don't want to be counterproductive.
Thank you. I'm going to Arlia, and then I'll go and finish with Pat Sheehan on the phone, so I'm going to Arlia first.
Yes, thank you, Chair. Just quickly, I know I had raised this at last week's committee meeting as well, in reference to the change in the regulations around the face masks. And I know that the Minister did respond in writing, I think, to the committee, and he might have referenced it in the Chamber during the week also. But I think there's still an issue around, the messaging being inconsistent. If you're now telling children of a certain age that it's mandatory and essential to have to wear a mask on their school transport or on transport, but not whenever they're going into a retail shop. I know some of the rationale was that the children are sitting in closer proximity to one another than they may be with another consumer in a shop. but has any other consideration or conversations been had around that issue, around the messaging, especially for children at quite a young age?
Panel?
Yeah, thank you, and thanks for that observation, which we're aware of. We do think that the circumstances, just going back to why the difference, the circumstances in retail setting are different from children getting on board school transport. So there is now good protocol in place in a lot of retail environments where social distancing can be maintained. So we were more concerned about that, people crowded into an enclosed place where ventilation mightn't be so great and so forth. So that's sort of the rationale behind it. Also, the fact that it is easier to communicate when a group of people are dressed in a post-primary school uniform, where the boundary lies between the requirement to wear a face covering or not to wear a face covering. So if we'd stuck with 13 as an age, that wouldn't have been workable in the school transport situation, and I'm sure Jonathan can say more about that. This is something that we will look at in the face coverings working group, and I think that's something we did reply to you in writing on that, and that group hasn't yet met again. But it's a valid observation which we need to now reflect on.
Thank you.
Thank you. And I'll go to Pat and then I'll come back to Pam on her previous question that she had. So, Pat.
Thanks, Chair. There has been compelling evidence for quite a while now that the wearing of face coverings does considerably reduce the transmission of the virus. And there are countries which have been very successful in reducing the transmission, particularly in Southeast Asia. And there has been a culture there for quite a while of wearing face masks. I suppose that it comes from their experience in dealing with other epidemics such as SARS, MERS, swine flu, avian flu, and so on. Has the department been involved in any research around the situations in which face coverings are worn in any of those countries?
I would say, first of all, that the wearing of face coverings is just one tool that's being applied here and in those countries as well. So there's lots of other factors around their success, I would suggest.
I understand that.
Yeah. So it's just one element. In terms of specific research into that, I would have to refer that to the Chief Scientist to see if he's aware of any. But I know that there's certainly a lot of interest in what has created the success in other countries. So we can certainly ask that question of him.
Okay, thank you. And Pam.
Yep, thank you. Thank you, panel. So I was asking earlier whether to learn what the process would be should, for instance, the requirement for children to wear face covering in public transport after today be required. So would fresh regulations need to be brought in?
Well, we separated at the end of July, we separated all of the face coverings out into a separate set of regulations that we've now been amending in parallel. So the only face coverings requirement that is embedded in the number 9 amendments to the main restrictions regulations are the wearing of face coverings in the places of worship. So that's the only part of the wearing of face coverings requirements that would fall with the number 9 amendment. And we will have to be mindful of that, of course.
Okay, thank you. Okay, and thank you, officials. There are a number of key pieces of information there that you have committed to forward to the committee, and we'd like those as quickly as possible, please. But otherwise, I want to thank you for your attendance today, for your addressing of the questions and answering those that you were in a position to, and I think that has been useful, I have to say. So thank you very much, and all the best for now, and good luck for the future. Thank you.
Thank you.
Okay, members, I'm going to now go through each of them, as we normally do. So SR 2020/232. This is the one that clarifies the meaning of self-catering accommodation, provides for a person to take part in indoor exercise with a sport with a carer or sport with carer or carers, requires the closure of hostels and similar establishments, provides that exemption in relation to caravans and motorhomes, and provides that hairdressing, makeup and other close contact services may operate in film and television production and define certain terms. So those came into force on the 29th of October. Have members any further issues they wish to raise in relation to that? If not, then can I ask members to agree formally that the Committee for Health has considered SR 2020/232, the Health Protection Coronavirus Restrictions Number 2, Amendment Number 11, Regulations NI 2020, and recommends that it be confirmed by the Assembly. Are we agreed? Agreed. Thank you, members.
Can I just ask again? Sorry, just on the procedure of this again. So, are those amendments the ones that we're passing as a committee now? They lapse tonight, but we're sending it to for the Assembly next week to approve something that's already fallen.
Yes, I think that's the case. Claire?
Just to advise that I'm not being specific to this one, but in many cases there are regulations that are confirmed despite various provisions having lapsed. You saw that with Amendment 8 in relation to the Derry and Strabane area, because there were a couple of definitions that had been tweaked which have longer lasting effect and don't fall, and therefore if the department is seeking to confirm things, sometimes there can be reasons like that.
And I will remind members we have written to the Executive, to the First, asking them to look at the process in relation to that. So are members agreed?
Chair, can I just on that point, can I just have it noted in the minutes that I think that it's somewhat strange that we're suggesting to the Assembly that they pass something that has lapsed, and I appreciate, but I think we need to continue to make this point until the Executive comes back with some alternative method. But thank you for taking that point. Thank you.
Thank you. Very quick, Jonathan.
Now, again, on the same vein, Chair, I totally agree with what Colin was saying, and he did suggest about a paper. I support an urgent paper regarding how other institutions within the UK and indeed the British Isles are dealing with these. Is it the same?
Yep, we've already agreed that. Okay, so members agreed. Thank you. Number 7, SR 2020/233. So this SR extends the requirement to wear a face covering to post-primary school children on school transport and on other public transport. Those regulations came into operation on the 29th of October. Do members have any further issues they wish to raise in connection with the statutory rule? Thank you. And then can I ask members to agree formally that the Committee for Health has considered SR 2020/233, the Health Protection Coronavirus Wearing of Face Coverings Amendment Number 3, Regulations 2020, and recommends that it be confirmed by the Assembly. Are we agreed? Agreed. Thank you. Moving on to SR 2020/239. So I remind members that these regulations provide for physical education to take place in schools and other educational settings, and that tables or other facilities in an area adjacent to hospitality premises are to be treated as part of the premises. The regulations came into operation on the 3rd of November and are subject to confirmatory resolution. Have members any further issues they wish to raise? No. Thank you. So if not, then can I ask members to agree formally that the Committee for Health has considered SR 2020/239, the Health Protection Coronavirus Restrictions Number 2, Amendment Number 12, Regulations 2020, and recommends that it be confirmed by the Assembly. Are we agreed? Members are agreed. Okay, thank you, members. I'm going to take a very short break there, and then we'll come back to our next item, which will be some of the SIs before us this morning. So could we come back there for 11:35, please, for a restart? Thank you.
Senate Chamber.
Okay, I'm just checking there. Patricia, are you online with us now at present? Patricia, I'm checking again if you can hear us at present over the system on the video conference.
I can hear you now.
Okay, we're hearing you there now as well. So I'm going to go first of all to Pam Cameron, Patricia, our Deputy Chair, Pam Cameron, for a question on this statutory instrument. Thank you.
Thanks, Chair. Thanks, Patricia. Hopefully you can hear us okay now. So in relation to the import-export provisions and the commitment to unfettered access means there will be no additional checks or processes imposed by GB on bloods, organs, tissues or cells moving from NI to GB, but no such protection on GB to NI movements. Can you give assurances that delays will be avoided and patient outcomes protected as a result of the new layer of checks east-west? That would be the first question. And the second one is, in around the administrative steps that are mentioned, and will the NHS have to foot the bill for those administrative steps? Thank you.
Thank you, Deputy Chair. I understand that most of the places in Northern Ireland that would import or bring in products from the UK already have import arrangements in place. For blood, there's some, but rarely imports from the rest of the GB for blood and blood products, as Northern Ireland's almost self-sufficient in blood products. So for those few times that those would be coming into Northern Ireland, we don't believe that there should be any risks to patients. What we are possibly looking at, and is sort of highlighted as a risk for exit day, is transporting. Obviously, because they come by road and boat, it's to ensure that there's no problems in getting those products across from GB to Northern Ireland. Organs predominantly move the other way. We in Northern Ireland have kidney transplants, but all other transplants are carried out in the rest of GB. So we don't expect there to be patient impacts around these areas. In terms of the administrative steps, we're still waiting on DHSC in England to provide us with the guidance for the administrative procedures. The trusts, etc., already import products, and the NIBITs also import occasionally blood products from the Republic. So the processes are in place already. Again, we expect that they understand the administrative procedures. We do understand that there's one tissue establishment that may need to implement new administrative procedures, and we have asked where the impact, the financial impact, will be borne, but we don't have an answer to that as yet.
Okay, thank you, Jonathan.
Thanks, Chair. And I suppose I deeply regret the need to look at these regulations here today. I suppose probably it outlines quite clearly the very damaging impact of the Northern Ireland Protocol. And the very fact that we're talking about, and the words within the statutory instrument look upon blood, organs and tissues, sales coming from GB into NI to be treated as import, I think is quite insulting. And I suppose probably that leads me on to my question. The briefing paper says that the Northern Ireland hospitals or facilities receiving blood or organs from GB will need to go through extra administration. If this is the case when EU and GB rules are the same, how much worse will the impact be if standards eventually diverge and further checks will be needed?
At the moment, you're quite correct, is the arrangements are the same and the standards are the same. Where the divergence may occur is, as you've rightly said, the regulations that making cars around blood tissue and organs has come back to the respective devolved administrations from Europe. And because we in Northern Ireland are having to maintain standards with Europe, if there's changes within Europe in any of these areas, Northern Ireland will have to maintain those standards, which will potentially be a divergence from the rest of the UK. As GB also has the ability to change to react to potential issues that they may have to amend their quality and safety standards around blood tissue and organs. However, to try and minimise and eliminate that, the devolved administrations and the DHSC are working together to put forward a common framework, which will be coming to you shortly to give you some indication and outline of what that will entail, to put in place agreements and communications and consultations around the divergence issue, to ensure that as far as possible there should not be divergence within the UK internal market. It also means that when if the UK is looking to make any trade agreements outside of the EU or in this area where there may be blood products, for example, that those are maintained on a nationwide basis.
Okay, thank you.
Just a quick follow-up, Chair. Has the potential implications of the Internal Markets Bill been factored into as to how it would apply to such a rule? A statutory instrument, sorry.
Because it's a slightly different definition of products, and we don't expect that there are any implications of the Internal Markets Bill, that it's not a good as such. It's a product of human origin, so it has slightly different quality and safety and movement standards, as far as I understand. But I will double check that and come back to you.
Thank you.
Okay, thank you, Patricia. And I suppose for me, the need for these types of measures are not flowing so much from the protocol, but indeed flowing from Brexit. And the protocol is required as a result of Brexit in order to protect our markets here and our food production, and all of those very important, and the health production. But do these SIs ensure that we will keep dynamic alignment with European Union law in this area in line with the protocol?
Yes, it has provided for the ability to make regulations in respect of EU changes. The protocol itself sets out that we can in Northern Ireland and the Secretary of State make amendments similarly to the 2.2 powers in the EU Communities Act to keep alignment with any new directives that come in through, or amendments to directives through Europe. So those powers are there to ensure that we can stay in alignment with the EU, and that is included in this. It also has removed, and in doing so has made the regulation changing individually in changing regulations in this area to GB alone, which means that in Northern Ireland we can't make any amendments sort of minimising EU standards.
Okay, thank you. And it states that the commitment to unfettered access means there will be no additional checks or processes imposed by Britain on blood, organs, tissues or cells moving from the north to Britain. And can I ask, was that agreed with the EU through the joint and specialised committees, or is that a unilateral British government decision?
I don't know the answer to that, but I can find out for you and come back to you on that.
Okay, please do. And there's also a question around, it states that regulators work with licensed and authorised establishments in the north, that they will work with them to support them as needed to prepare. So between this SI being led and the end of the year, is 6 weeks enough to provide that work and support that those establishments will need, in your opinion?
In my opinion, I believe that most of the standards and the ability to provide the work that is necessary is already there. DHSE have been in contact with the establishments and will provide directly support to ensure that any other movements are in place for the end of the year. As I have said before, Northern Ireland is predominantly self-sufficient in blood and will sometimes bring in blood and blood products from GB and very occasionally from the Republic of Ireland. However, organs will predominantly move the other way from Northern Ireland to GB. So 6 weeks, while is short and is probably adding pressure, it is doable.
Okay. And in relation to the reference to competent authorities, that will those competent authorities be taking on roles similar to national member states, competent authorities in other EU countries?
Yes, the competent authorities will maintain for Northern Ireland the same conditions as they do currently. Okay. So any they do for EU currently, they will maintain those for Northern Ireland.
Okay, and is the sum impact of all of that, will safety and quality standards remain unchanged with this SI?
As of 1st of January, yes. In the future, this SI may well be, there may be amendments in future, but this will maintain quality and safety standards for blood tissue and organs as they are currently from the 1st of January.
Okay, thank you. Quick point, John.
Just a brief question through you in terms of, and the official may not have this, but is there any breakdown of current provision to Northern Ireland of blood, tissue and organs in terms of whether it come from GB or indeed wider Europe?
I have some figures. I can provide that to you in a bit more detail. My understanding is that we are predominantly self-sufficient in blood in Northern Ireland, with some movement from GB and very minimal amount from ROI. Organs, the UK is predominantly self-sufficient, with including ROI in that agreement on organs and organ transplants. But I can provide you with probably a bit more detail on that. But I'm not aware that Northern Ireland does, but I think that GB does.
Okay, thank you. Okay, thank you, Patricia, and we look forward to receiving those additional pieces of information. And thank you for your attendance and answers today. Thank you.
All right, thank you.
Okay.
Bye-bye.
Bye, Patricia. Okay, members, any other issues, or are members content to note the SA? Yep, members content to note. Thank you. Moving on then to SL1, the Food Miscellaneous Amendments, etc. EU Exit Regulations NA. The Food Standards Agency advises that the Department of Health proposes to make a statutory rule to revoke the Food Amendment NA EU Exit Regulations 2019 and to ensure at the end of the transition period that the legislation it was intended to amend remains operable. It also makes some technical amendments to domestic regulations. The FSA advises that minor amendments are proposed to legislation in relation to natural, spring and bottled water regulations, but that ongoing policy and legal considerations may require further SRs to be made. The FSA further advises that amendments are also proposed to the Food Hygiene Regulations 2006 to ensure businesses continue to meet the necessary requirements on the form and application of health and identification marks at the end of the transition period, and to reflect the application of the North of Ireland Protocol. I can advise that an official from the FSA is available to respond to members' questions if required. So do members have any issues they wish to raise with?
Questions?
Yep. So then I would like to welcome to address questions Miss Catherine Baker. Catherine, can you hear us there okay? Sorry, we don't have Catherine online. Will we stick? Yeah, I'll suspend there for a second.
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly.
So just while we're so I think we might have Catherine now on the video conference. And Catherine, can you hear us there now?
Okay, thank you. Bye-bye.
Hi, Catherine. Welcome to our committee meeting this morning, Catherine. And we do have a question, or at least one question, from Deputy Chair Pam Cameron. Go ahead, Pam.
Yeah, thanks, Chair. Thank you, Catherine. I'll not keep it too long. I was wanting to ask around any future divergence on labelling or composition of food between GB and NI, and adding to existing checks and customs on food that will be required from day one in 2021. If you could tell us a bit more about that. And do you envisage a situation where baby food, for example, sold in GB would not be available here in Northern Ireland to the consumer?
Okay. So, Pam, you've raised 3 questions there. So if I can just pick up the first question, which is regarding potential divergence to labelling and composition. So as you'll be aware, with the Northern Ireland Protocol, Northern Ireland will continue to follow EU regulations in this area. So we will continue with the same standards that we do now, and obviously as that changes with EU rules, we will follow pace with that. That does then mean that there is a potential for divergence with the rest of the UK going forward after the 1st of January. Members will be aware that there are other strands of work through common frameworks to constantly be aware of these issues and for these issues to be discussed through those frameworks. So there are mechanisms to consider where there would be divergence and what it would mean for the UK internal market and Northern Ireland. So yes, in answer to that first question, that is a potential in the future. If you'd like me to go to the second question, so you asked if there, I think you asked me if there is likely to be existing checks on imports on the 1st of January. Can I just check that?
Yes, thank you. That's right.
Okay, so yes, again, under the Northern Ireland Protocol, the Northern Ireland, as I've said, will continue to follow the EU rules, and that includes the import rules that are contained within official control regulations. So there will be a requirement for checks on food and feed coming into Northern Ireland from GB. Not all food, certain food where there are particular EU regulations around import checks. However, we are working very, very closely with DERA, who are the lead Northern Ireland Government department on this work, and also with the district councils who will deliver that service on the ground alongside DERA. This is obviously all subject to negotiation within the joint committee, so much of this is still being discussed. And so, the full scale of what an import regime will look like is still within consideration. And I think the last question you asked was around baby food. And I'm sorry, I'm not entirely sure that I can answer you on that today. We can certainly come back to you on that. So I wouldn't like to commit to anything that might be untrue. So if we can come back to you in writing, that would be good. Thank you.
Appreciate that. Thank you.
Thank you. I'm going to Jonathan.
Thanks, Chair. And although technical, this amendment is part of a wider process that will separate Northern Ireland from the UK food standard regime and risk further divergence along the line. So can I ask, how do these changes interact with the letter by the First Minister and the Deputy First Minister to the EU, setting out concerns around barriers to the supply of food?
Yeah, as you point out, there is obviously these are very related because the First Minister and Deputy First Minister letter is concerned with any new import regime and how that could impact on food supply. So yes, there are a lot of interdependencies. What I would say is that the conversations at a joint committee level are still ongoing. So this is not the final outcome is not determined yet. And certainly within the DERA programme, all the delivery partners were very aware of food supply issues, and those issues are being fed in to the conversations.
Okay, thank you. Any further questions, members? No. Okay, thank you, Catherine, for joining the committee and for providing that information, and we look forward to receiving the further information that you have. Clerk, did you have something there?
Just stay on the line just in case there are questions on the next item.
Yes, we're going on to the next item then, so if you could just stay on the line, please, Catherine, thank you. So, in relation to that SL1 then, have members any further issues to raise? Is the committee content that the department makes the statutory rule? Yeah, members are content, thank you. Moving on then, members, to item 11, which is SL1, the Food Hygiene Rating Act Amendment Regulations 2020. The Food Standards Agency advises that the Department of Health proposes to make a statutory rule to allow a technical amendment to the Food Hygiene Rating Act 2016 insofar as it will replace references to repealed EC Regulation 882/2004 with references to the EU regulation replacing it. The FSA advises that the amendments are necessary to provide a mechanism for new mandatory food hygiene ratings to be produced for existing or new food business establishments, but that the amendments contained in the proposed statutory rule will be minor and technical in nature and will not make any policy or operational changes to the statutory food hygiene rating scheme. So we do still have Catherine on the line. Do members have any questions in relation to that? Catherine, can I just ask, is that food rating, will that be a new scheme or a continuation of the current scheme?
Yes, so this is a continuation of the current scheme. There's absolutely no change to the current scheme, only that a European regulation that we had referenced in the Act has been repealed and replaced with exactly the same provisions. It's just a new regulatory title, so we just need to reflect the Act in accordance with that, but it is the same scheme and there's absolutely no change to how it will operate currently.
Thank you. Jonathan and then Pam.
Thanks, Chair. Just to follow up on that, is it likely that businesses and restaurants in Northern Ireland and elsewhere in the United Kingdom will be rated on a different basis going by these standards? Will this potentially add disproportionately red tape to Northern Ireland business? So will there be a differential?
Okay, so on day one, we all follow the same rules, and actually the rules in this regard and what the businesses are assessed against are general sort of hygiene standards that apply across the board and generally follow sort of global standards in terms of hygiene in businesses. So it's very unlikely that there will be really much difference, and certainly there will be no difference for the Northern Ireland businesses in terms of how they are assessed in terms of their food hygiene standards and subsequently how they get their rating. So there will be no additional admin burden on the businesses here.
Thank you. Pam?
Yeah, and just briefly, you maybe covered it, Catherine, but I'm just wondering, do you know what the situation is in GB in relation to their continuation of the Food Hygiene Rating Act?
Yes, so in England, actually, the scheme is not a mandatory scheme the way it is in Northern Ireland and Wales, but certainly in England, the Food Standards Agency is keen that the scheme would become mandatory at some stage. However, the scheme does operate in England. Ratings are provided to businesses. Businesses do display those, and we always provide them on our website. And the schemes are currently consistent across the 3 countries. So the only difference is that it's not a mandatory requirement on the business in England now to display their rating on their premises, but hopefully that will change in the coming future.
Okay, thank you.
And Catherine, the operational date I note within this is the 23rd of December. Why is that so late?
I think it's just with all the other legislation that needs to go through, the scale of legislation we've been working on. It's just trying to fit it in with existing timetables. So we do just need to get it in this year while we've got the provision in the European Communities Act to make this amendment.
Okay, thank you, Catherine, again for addressing those issues for us, and I think we can. That's okay. That's all we need from you this morning. But thank you very much for attending our committee hearing this morning. So, members, any further issues to raise with that? And is the committee therefore content that the department makes this statutory rule? Committee's content. Thank you. Okay, members, moving on then to item number 12, legislative consent motion, amendment to the Medicines and Medical Devices Bill. I refer members to departmental papers at tab 12 of your pack and to the clerk's memo at tab 12.5 of tabled papers. Can I advise members that officials from the Department of Health are here by video link to brief the committee on the further legislative consent motion led by the Minister of Health in respect of the Medicines and Medical Devices Bill introduced in Westminster? So I'd now like to welcome Ms Cathy Harrison, who is Chief Pharmaceutical Officer, Ms Bernie Duffy, who is Head of Medicines Policy Branch, and Mr David Wilson, Head of Safety Strategy Unit. And panel, can I advise one of you have feedback there? Is there an outside link live or something like that? So that is dropped. Hopefully that's addressed. Can I advise or ask you all to ensure that if you're not speaking, your phone is on mute? And can I just check if Cathy is on the line with one of you or is on the line separately?
Mr. Chairman, can you hear me? I don't have access to a video link tonight, so I'll just dial in.
Okay, that's fine, Cathy. That will work fine. So you're welcome to committee this morning. Thank you for coming along. And could you now go ahead, Cathy, and brief the committee on this LCM? Thank you.
Mr. Chairman, thank you for the opportunity to brief the committee today on the Medicines and Medical Devices Bill, with particular reference to those provisions of the bill that deal with human medicines and medical devices information systems. I'm going to hand over to my colleague Bernie Duffy, who will provide the briefing for the committee, and then we will be happy to answer questions afterwards. Thank you.
Thank you. Yep. Okay, Bernie, go ahead. Thank you.
Yep. Can you hear me, Chair?
Yes, we're hearing you loud and clear. Thanks.
You go on mute. Okay. So the committee will recall.
There's some feedback on your line there, Bernie.
Yeah, there is.
Yeah, there's quite a bit of feedback actually, Bernie, on your line. I think it's your line.
Is that okay now, Chair?
Yeah, that seems better. Yeah.
Okay. Okay, Chair. Thank you. The committee will recall that the Assembly agreed legislative medical devices bill on the 16th of June. Now the existing regulatory frameworks for medicines, medical devices, clinical trials and veterinary medicines to be updated or amended by means of subordinate legislation. The bill seeks to update the equivalent, or to provide the equivalent delegated powers as are provided by Section 2.2 of the European Communities Act 1972, without which the UK Government and Northern Ireland Assembly would have to rely on primary legislation to make any changes to regulatory frameworks. The need for a further legislative consent motion has arisen because of an amendment made to the bill at Commons report stage in respect of medical devices information systems, and more recently, government amendments currently being considered for agreement at the Lords Committee stage. These were mainly in response to concerns regarding the bill.
Bernie, sorry to interrupt you, Bernie. You're cutting in and out a bit there. It's a little bit hard to follow you. I'm just wondering, Bernie, you're cutting out a bit.
A government. Let me just turn up my volume.
Yeah, and also there seems to be some movement. There seems to be some, at times you're breaking up altogether, but we'll try it there with a bit louder volume, and if you just take it as slow as you can, please. And there is some other noise coming through on the line. We are getting, and it could be any of our panel or MLAs there, but there is feedback coming through a line. Someone is not on mute.
Yeah. What's the volume like now, Chair?
Can I just ask everyone else, apart from, I don't think it's you, Bernie, can I ask everyone else to make sure your phone is on mute, and we'll go ahead then again, Bernie, we'll try you. Yeah. Go ahead, Bernie.
Okay.
Yeah.
Okay, so a government amendment to the Medicines and Medical Devices Bill was made and passed during the Commons report stage on the 23rd of June. And this provides a power to establish a medical devices information system operated by NHS Digital. Regulations under a new clause headed Information Systems will enable the Secretary of State to instruct NHS Digital to create and operate a medical devices information system for the whole of the UK, including Northern Ireland. This amendment is in response to the report from the Independent Medicines and Medical Devices Safety Review, which was chaired by Baroness Julia Cumberledge, entitled First Do No Harm, which was published on the 8th of July 2020. The aim of a medical device information system is to improve the safety and standards of medical devices by ensuring better information can be captured and shared on implanted devices in order to identify risks posed by specific devices much earlier. The medical device information system will provide critical benefits to patients who have been, or indeed will be in the future, implanted with medical devices. These include the collection and storage of information linking unique identifiers to patients, clinicians, and the specific surgical procedure that implanted the device. Establishing systems that will enable health providers to trace patients who have been treated or implanted with a medical device so that the patient can be provided with the appropriate medical treatment if a safety issue occurs with a particular device. It is important, therefore, to ensure that regulations to be developed to implement the information system take account of the governance arrangements in Northern Ireland. In response to concerns raised by the devolved administrations on this point, an amendment is being proposed by the Government that when making regulations under Clause 16, the Secretary of State is required to consult Scottish ministers, Welsh ministers and the Department of Health in Northern Ireland. In addition to this amendment, there's a separate non-legislative commitment from DHSE to ongoing discussions on the medical device information system governance arrangements and other operational details that will ensure that the Department of Health in Northern Ireland is engaged in relevant policy and operational discussions and the development of draft regulations. I will now turn briefly to the other amendments currently being considered at the Lords Committee stage. The first of these is on disclosure of information in accordance with international agreements. So in order that the UK, and in particular the MHRA and the Veterinary Medicines Directorate in Northern Ireland, can continue to work with international partners to ensure the safety of medicines in the UK, there is a need to strengthen the legal basis for sharing information internationally. This would be in the form of a statutory information gateway inserted into the bill. And this is to ensure that vital information can be shared with bodies outside of the UK, such as overseas regulators. This amendment has been agreed at the Lords Committee stage on the 4th of November. The other amendments being proposed by the Government at the Lords Committee stage are mainly in response to the report by the Delegated Powers and Regulatory Reform Committee, which included concerns in relation to scrutiny and oversight of the use of delegated powers contained in the bill. However, the majority of these powers sought reflect the powers that are currently available to the UK and indeed are found within the European Communities Act 1972. The Government amendments are to provide reassurance about how the powers are intended to be exercised, and I will outline these now for you. In order to address the concern of the committee that the bill provided the Secretary of State with too much discretion in how the powers are exercised, an amendment will be tabled to provide for a reporting obligation on the Secretary of State that would consider the operation of regulations made under clauses 1, 8 and 12 within a specified reporting period, which is once every 2 years. And this will set out the views of those who have been consulted, whether a change has been made as a result of the consultation, and indeed including a look ahead at further proposed regulatory change known at the time within the forthcoming reporting period. It is proposed a separate will be taken forward by the Northern Ireland departments in respect of any regulations made only by Northern Ireland departments, and this will be laid before the Assembly. Concerns have also been raised about the use of the negative procedure in relation to regulations made under clauses 1 and 8, and in particular those relying on clauses 2 and 9. It is intended to amend clause 42 of the bill to apply a draft affirmative procedure in Westminster and in the Northern Ireland Assembly, so that all regulations made under these clauses, except for those relating to fees and any urgent regulations made relying on Clause 6. It's also intended to amend Clause 42 of the bill so that urgent regulations relying on Clause 6 are subject to the made affirmative procedure. This is similar to the confirmatory procedure in the Northern Ireland Assembly, whereby regulations are laid after being made and cease to have effect unless they are approved within 40 days. Another matter on which there was considerable debate prior to the Lords Committee stage has been the application of the 3 considerations that the appropriate authority must have regard to and how these considerations are weighted when making regulations. To respond to concerns about the absence of a definition of attractiveness of the UK, it is intended to clarify that this is a consideration of the relevant part of the UK being seen as an attractive or favourable place in which to supply and conduct criminal trials for human medicines and develop and supply veterinary medicines. The Government is seeking by amendment to clarify the intent in this regard. It is also intended to provide an overarching duty to have regard to the importance of promoting health and safety of the public and in relation to veterinary medicines, the health and welfare of animals. The considerations currently in clauses 1 and 8 of the bill will then form part of satisfying that duty. It is intended to provide that the appropriate authority must be satisfied that the regulations would promote the health and safety of the public in relation to veterinary medicines, the health and safety of animals, and have regard to the considerations currently in clauses 1 and 8 when determining whether they would. This will strengthen provision around the exercise of these regulation-making powers and provide reassurance that it is only intended to make regulations to amend the current regulatory regimes where those.
Sorry, we just lost you there, Bernie. Bernie, we just lost you there. Were you saying were those? We lost you for a few seconds.
Am I back?
Yeah, you're back now. Thank you.
Okay. Do you need me to repeat any of that?
Yeah,
Chair,
just
or are you happy enough?
Yeah, if you just repeat the last sentence or so, Bernie, we did lose some of that.
Yeah. I said it's intended to provide that the appropriate authority must be satisfied that the regulations would promote the health and safety of the public and in relation to veterinary medicines, the health and welfare of animals. This would strengthen provision around the exercise of these regulation-making powers and provide reassurance that it is only intended to make regulation to amend the current regulatory regimes where those changes promote health and safety. A further concern was the ability to create new criminal offences through regulation-making powers, and more specifically, that the powers may be amend the penalties for existing offences with no restriction on the maximum that can be set. The Government proposed.
We're losing you again, Bernie. We're losing you. I'm not sure what's happening there, but we've lost you there again. Bernie, we've lost you there from. Bernie, apologies, but we have lost you there from criminal offences forward. New criminal offences. Can you hear me, Bernie? Bernie, can you hear me there? Negative. Yeah, we appear to have lost. We'll need to suspend there for a couple of minutes to see.
Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound.
Okay. So Bernie, I'm hoping we've got you back on the line there, Bernie, and maybe if you try to take yourself off the video function and go with audio only, it might help the feed. But can I check, are you there and are you hearing us, Bernie? Can you hear me there, Bernie?
Yes, I can hear you.
Okay, we're hearing you there now, Bernie. If you keep your video off for the remainder, it may help with communication. So we lost you there where you were saying around new criminal offences. If you could pick it up from that point, please.
Certainly. I just finished by saying that the Department of Justice had previously considered the bill and more recently the amendments proposed and were content that the current offences and penalties are necessary and commensurate with the current offences and penalties framework in Northern Ireland.
Okay, is that you finished, Bernie? So just checking then, I'm checking in with Cathy. Cathy, is there any other briefings, Cathy, or is Bernie's briefing complete at that?
No, Chair, mine is the only briefing, and then we're going to take questions.
Okay, so we'll go ahead then to move to questions now. So I suppose the first question from me is in relation to, is there an interplay or interaction between this LCM and the Irish Protocol? And because I presume that medical devices count as goods and would come under its remit. So are there any implications for any of these amendments on the protocol? And if so, what contingency planning has there been to deal with those issues? Go ahead, Bernie.
Chair, Cathy here.
No, we're getting feedback coming through there.
There are no implications from the change on this legislative consent motion in relation to the Northern Ireland Protocol. Chair, we can advise. Thank you.
Yeah, go ahead, Cathy. We are hearing you there. I think that's Cathy speaking. Sorry, we're not hearing you at the minute, Cathy. Could you try that again? Or Bernie?
Sorry, Chair, could you repeat the question there? We're just having a bit of feedback on the line.
Yeah, it's very important that you aren't on the live as well as on the Starleaf system. That created some of the problems in an earlier session. So if I can just ask you all to ensure that, first of all, you're on mute if you're not speaking, and second of all, that you're only connected on via the main system. So my question was, are there any implications for these amendments for the protocol? And if so, what contingency plans have there been to deal with those issues? Or indeed, would we need our own system here to deal with those types of issues?
Mr. Chairman, Cathy here.
Cathy, there's very bad feedback on your line.
These connection problems, Mr. Chairman, we're all struggling with this. No, there are no implications in relation to the Northern Ireland Protocol and the LCM. Thank you.
No implications whatsoever?
Not in respect of the legislative consent motion, no.
And how can you, like, I'm honestly, I just don't understand how you can you tell us what the remit of it is or how you're so certain about that?
Mr. Chairman, the main sort of implication of the LCM that we're seeking here is the new data information system for medical devices. and that is there's no implications in terms of that, in terms of trade or in terms of movement of goods or anything else in terms of Northern Ireland Protocol.
Okay, and in relation to the data element of it, are there any concerns about collecting and sharing patient information with NHS Digital in terms of data security and the ownership of that data?
Yes, that's David Wilson here, Chair. That is the reason why we've sought the amendment to the bill, so that we can be involved in the regulations in the aspect of this and involved in the preparation of those aspects. The legislation will be, in fact, allow the NHS Digital to collect our data from our patients and from our health service, and will be able to be storing it securely on our behalf.
Okay, and finally from me, the Minister has referred to governance arrangements. Is the Department content with the assurances received that all of the various, and in particular here, that we will be consulted on these regulations in the future?
Apologies, Chair, I could not make it out. Could you repeat the question, please?
Yeah. In relation to the governance arrangements, is the Department content with the assurances received and that we will be consulted in terms of future regulations in this area?
Apologies, Chair, again. I didn't get that question coming through here.
Okay, the Minister has sought assurances. Are you hearing me there at the minute, David? Are you hearing me now?
I can't hear the speaker.
No, okay, I'm going to pause there again. I'm going to pause the meeting.
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Okay, I'm going to just make another check to see, can the officials who are on the video conferencing hear me now? No. Okay. Okay, we have decided that we will submit questions in relation to this issue in writing, given the Department's difficulty in connecting today. We will submit questions in writing and ask for an urgent response from the Department in writing to our committee. Thank you. Okay, thank you, members. So we're going to continue then with the rest of our business. We're turning to correspondence. Yes,
Chair, could I just request those questions to be emailed to me as soon as possible, please, members?
Can you send out a reminder after the meeting just so that we can respond to it? Because I have another committee meeting after this. So.
Okay.
Chair, can I just make a point of order?
Yep.
If it's possible. Chair, I know that there's technological problems, but whenever you come out of private session, none of the members that are on by Spotlight are able to participate, but also just to let you know that we can all hear everything that you're saying. So I just think there needs to be great care in case you go into private session to talk about the people that are in the spotlight, because they can actually hear you, but we're not able to actually participate in the conversation and update you on what our experiences are from here. And this wasn't always the case. There used to be a way that whenever you went into you went into private session, that the members of the committee were able to remain in the spotlight and talk and chat, but we're being put out as well, and it's not good.
Yeah, I agree, Colin. It's not satisfactory. I think this issue does need to be looked at, and I think the committee needs to write again and ask for this to be addressed. I mean, it's very difficult to conduct proper scrutiny and analysis in this context. It's just not good enough.
Brothers, can I ask that, where appropriate, can we have officials come to the committee? Because we do have space provided for them, and I think it's only right, given the seriousness of these issues, that if possible, given the proximity to the Department of Health building with this Senate chamber, that they're here in person if can be.
Yeah, I think as members, I think that's
as long as it's safe.
I noticed, Chair, just in the first presentation today, and it might just be me and lack of good hearing, but I was struggling actually. I was losing words. You don't get a whole sentence. You lose vital words out of a sentence, and it really is. It's really hard to keep up when they're here. You don't miss a word.
Yeah, no, and I found that is the case, I think, for all of us, Alan, as well, so thank you for that point. Okay, well listen, members, members, please email any questions you have in relation to this session. We'll send it down to the department and try to get prompt responses to those, and we'll see what we can do in terms of conducting our business more in the future. Okay, members, thank you for that. I'm moving then to correspondence and turning to, I refer members to correspondence at tab 13 of the pack and to table papers, and in your table papers, and also to the correspondence memo at tab 13.1. There are some items that I would like to draw members' attention to. First of all, item 13.17 is a note of the meeting between some of those affected by the neurology patient recall, the Minister of Health and senior departmental officials. So, any comments on that? Yes, Jerry, go ahead.
Thanks, Chair. I think it was important that the meeting did take place. I know it was a while coming. I think just quickly the patients have said they don't want a tick box exercise. Communication is important, and a range of other issues as well, and I think it is important. I'm sure many of them are thankful that the Minister apologised to the way they've been treated as well. So I think it was a long time coming. It shouldn't have taken this long, but I think it's hopefully it's moving in the right direction for those patients.
Yep. Okay, yeah, and I also would welcome that engagement. I think it is really important and really valuable to all sides, to both sides or all sides or all parties, where these engagements take place, and that people's experiences are being heard directly and impacting on the work that's ongoing. I think that's a hugely important issue. So, would members be content to note for now, pending further scrutiny in the new year? Yep. Thank you, members. Item 13.22. Sorry, I've seen Pat Sheehan there. Pat, do you want to come in on that neurology issue?
Yeah, yes, Chair. It's actually in relation to 13.18. It's in relation to the neurology forward work programme, I suppose you could call it. It's particularly in relation to the review of deceased patients of Dr. Watt, and there seems to have been a problem in developing some sort of legal framework in order for the Belfast Trust to release patient records to the RQIA. I find this situation very unsatisfactory. In fact, I looked back at notes from a neurology cross-party meeting on the 4th of October 2018 when we were told that the deceased patient review would be finished by June the following year, which was June 2019. I then had a meeting with the RQIA in October 2019, and I was told at that meeting that the legal framework was close to completion, and they expected the review of deceased patients to begin in early spring of 2020. Now, obviously, we've had COVID since then, and everything appeared to have stopped from March until June. But I mean, COVID is being used to cover up a lot of things, where work has stopped. And it seems, it beggars belief to me that work on a legal framework would have to stop on the basis of COVID. But, I mean, we're 2 years on since we were told the review would be completed within 7 or 8 months. I just find it highly unsatisfactory. And I'm not sure whether that was one of the issues that was raised with patients who met the Minister. Probably not. But it's something, I mean, I have been dealing with some relatives of deceased patients who are very unhappy about the length of time it's taken to begin this review and complete it.
Okay, would members be content that we seek further information in relation to the difficulties of that legal framework, given that COVID has been put forward as a reason that we seek further information as to why COVID is or what's impacted? Members content with that?
Yep.
Yep.
Chair, just before you go on, it was very useful having Brett Lockhart and Hugo Massey-Taylor a few weeks ago. I thought it was really very useful session, but obviously from the correspondence it's just one element of the investigation into what happened, and I think that it's possibly maybe in the future even to invite then the department or RQIA to talk specifically about that. Obviously we're preoccupied with COVID still, but I do think that that's something we need to come back to, because there's some elements around the redress. And as Pat alluded to then, the deceased patients, there's elements of this that I'm unhappy with in terms of the rate of progress as well.
And actually, members, I'm reminded now, in our forward work, we have requested an oral briefing in relation to those other strands. So actually that might pick up on that concern and your concern, Paula. There is a briefing in train with the department asking for those other strands, so we can pick up on these issues then. But I think they're worth looking at. Okay, members. So. Moving on then to another item in table papers, 13.21 is a reply from that's the one I'm referring to there. So are members content to note then in relation to that, pending the further work in the oral briefing and the further members content with that? Thank you. So moving on then. Are members content with the actions as suggested in the correspondence memo at 13.1 of the pack? Yeah, members content. Moving on then, members, to forward work programme. So item 14 there, members, in the draft is 14.1. It has the draft forward work programme. Are members content to note the forward work programme? Yeah. Okay, members are content. I also want to just return members to in relation to the LCM there, which ended kind of in that technological difficulty, and we had agreed to look at forwarding questions, but there was another issue that needed dealt with in relation to that. So can I ask members in relation to the LCM on medicines and medical devices bill? That LCM contains provisions relevant to the Committee for Agriculture, Environment and Rural Affairs. Are members content that we seek the views of that committee on that LCM as well? Absolutely. Yeah, members content. Thank you. So, returning then, members, to...
Sorry, Chair, I had another issue around the forward work programme, and that was, I think that there was a request in from the Stroke Association. I think it would be useful if we had even an update of who's still outstanding, who put requests in to give evidence to the committee, please.
In relation to the consultation, Paul, is it?
No. Moving past the consultation, I'm just saying in terms of the requests to give evidence to committee, we haven't been able to fit them all in so far because we've had our inquiry and the COVID response updates. But it's just really we're fast approaching Christmas recess, and then just for going forward from January, who are we really waiting to hear and how we can prioritise that?
Yep. Okay. Yep. Members content with that. Thank you. Yep. And members, also in light of the fact that we have decided to kind of look at the whole issue of find, test, trace, and how that might impact on our ability to deal with the pandemic, and to try to avoid elements of going in and out of lockdowns. Would members agree that it might be timely for us to arrange a session with international experts to look at best practice elsewhere again? We could, similar to the last time, ask RAISE to provide us with a panel of experts from countries that have experience of that. So would members, so we could ask academics to brief us on how the most successful fine test trace systems have been developed. Are members content with that?
Yeah.
Yeah, okay.
Are we going to have that before the committee motion?
It will be unlikely. I don't think that will be possible, given the motions on the 23rd. Yeah. So, going on then to any other business. Do members have any other business today for this meeting? No. Date and time then and place of the next meeting. So before we move into closed session to begin our consideration of evidence on our care homes inquiry, I would advise that our next meeting in public will be on the Thursday, the 19th of November at 9:30 in the Senate chamber. Okay, thank you, members.